So good evening, everyone. Is my camera visible and am I audible?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes,
So I'm
ma'am.
Meenakshi Vinod and I'm physiotherapist and I'm working at Royal Care Hospitals, Coimbatore. So I'm a certified antenatal and postnatal instructor. So today in this webinar, we'll be seeing through all the phases of pregnancy, what happens during labor, and what can we do postpartum. So you'll get a complete idea about the starting till the end, how to deal about the clients or patients with OP department or as IP or as your clinics or even as your house visit. So I would like all of you to keep being active, at least in the chat box, or you can unmute and ask me any doubts at any time. I have logged in from two devices, so your chat box would be visible to me throughout the session. Okay, any doubts or anything you want to ask me right now? Or shall I start? So if you have any difficulty in understanding with English, you can let me know. My native is Kerala, so I know Malayalam. I've been raised in UAE, so I know Hindi and English really well. And then now I'm in Tamil Nadu, so I really speak Tamil also. So anything you can let me know, I can clarify it in your convenient language. Okay?
English is okay, ma'am.
Yeah, I'll take the class in English, but in case you have not understood something clearly, you can let me know and I'll immediately clarify to you personally. Yeah?
Sure.
Okay. So shall we start?
Yes, ma'am. Please continue.
Okay. I would like all of you to at least be active on the chat box.
Also, it is requested if it is possible, please keep your cameras on so it will be more interactive during the session.
We're going to talk about the I'm going to speak about the antenatal exercise and about the antenatal phase of the pregnancy. So first, we're going to speak about the pelvic floor muscles. So pelvic floor muscles are a really important part in your antenatal as well as your postnatal program. So as far as the division of obstetric and gynecology is considered, mostly we'll deal with the pelvic floor muscles and the muscles surrounding the pelvis and the surrounding regions. Okay. So in pelvic floor, what is the function of pelvic floor? If you see, its major function is to separate the perineum from the pelvic cavity. Along with that, it helps holding all your abdominal organs, as you can see in the picture, bladder, uterus, rectum. All of this is held by this one single sling of muscles, which is your pelvic floor muscles. So I am not going into detail of the origin and insertion, but most of it starts from the pubic bones and it ends in the coccyx. Okay. That's their insertion. If you want to know about any muscle in detail, you can ask me. But since most of your third year and finished your UG, I'm assuming that you know the origin insertion. So pelvic floor muscles are mostly two major muscles, levator ani muscle and your coccygeus muscle. So levator ani, like I cannot say three parts, but you can see three components of a levator ani muscle is a puborectalis, pubococcygeus, and your iliococcygeus muscle. Okay, so all of this is like just slinging around in your pelvis and making the pelvic floor. So as you can see, there are two hiatus mentioned here, right? So in your pelvic floor, there are two openings, which is known as the urethral hiatus and the rectal hiatus. Okay. So the urethral hiatus is where the it is present anteriorly, as you can see, and it is where the urethra and the vagina passes through, while the rectal hiatus is between is placed between it, and it is between the perineal body, and it's where the anal canal passes through. Okay, so any kind of fecal continence, incontinence, or urinary incontinence, any kind of pelvic floor prolapse, our major target is the pelvic floor muscle. Along with that, even in the antenatal and even the postnatal period, our major target will be the pelvic floor muscles and how to strengthen it. Now, the next question is, can we literally train the levator and coccygeus muscles separately? No, these are very, very deep structures, and you cannot like focus on one muscle separately. Like, we can go for VMO, vastus medialis oblique, strengthening separately, but we cannot go for levator ani separately, coccygeus separately, or any of these muscle groups separately. It can be trained together. Okay. Any doubts so far, or can I move on further?
It's clear, ma'am.
Okay, thank you. So now, next, we are going to speak about the phases of pregnancy. So, as we all know, there are three trimesters: first trimester, second trimester, third trimester, and then it is the birth, and then the postnatal will come here. Postnatal period will come here. Okay. So it is divided into three stages. First trimester is from this conception to 17 week. Second trimester is 18 to 28 weeks. Third trimester is 29 to 40 weeks. Now, if you Google the phases of pregnancy, you're going to get different timelines. This is the most commonly used trimesters in the article reference. Okay. And as far as I know, most of the hospitals follow this. In case your clinical hospital says the patient is in 18 weeks and they say they're still in the first trimester, please do not say they are wrong or anything. It is okay. 1 week here or there is considered fine. So this is like a rough figure I'm giving you as per most of the articles which have been published in PubMed or any other good websites. Okay, these are the mostly seen trimester. 1 week or 2 weeks here and there is absolutely fine. Please don't think you're wrong or the gynecologist is wrong. Okay. So moving further, we mostly deal with the complaints that the patient have, right? Not maybe not in OG sector, but in any other sector, maybe it can be weakness, it can be pain, it can be stiffness, it can be anything. So let's see what are the complaints which our patients will come up with in the first trimester, second trimester, and third trimester. So in the first trimester, they're going to complain about nausea, vomiting, any kind of cravings, any heightenedness of smell, and mood swings. These are the common symptoms, you can say so. So this is not a disease. So you can't say it as symptoms. You can just say these are the complaints they come to you with. Okay. Next, talking about the second trimester. Second trimester is when all the pain starts. Okay. So round ligament pain, any nipple changes, stretch marks. They start feeling a baby moving. They feel lots of discomfort. They find inner thigh pain. Can you take slowly? Okay, I'm sorry. So they will feel any inner thigh pain like that. It is the second trimester. Okay. In the third trimester, you will start feeling small kick from the baby. You will feel some swollen feet. You can feel some leaking from the breast. You can feel frequent urination. All that happens in the third trimester. So conceptually, if you see, from the first trimester to third trimester, the baby starts growing. So more and more pressure comes when they reach the third trimester stage. That is why frequent urination, leaking, it's at last stage, they're going to push out the baby. So in that way, you can remember your symptoms or your complaints. So postpartum, if we see, they're going to speak about lochia, fatigue, sore, leaking breast, and risk of any postpartum depression. So, anyone has any idea what is lochia?
No, ma'am.
It's a
Okay.
discharge after delivery, I guess.
Yes, yes.
Like to
Yes, you can continue saying, ma'am.
It's a discharge after delivery, which is rubish red in color, and the
Okay.
consistency of color keep changing in 2-3 days, like
Yes. Yes, you are right.
Elba on the third day when it becomes a little whitish or something.
Yes. Okay. So I'll explain that to you in a little more detail. So lochia is, as ma'am said, it is a kind of discharge which comes from the vaginal area postpartum, that is post-delivery. So as you all know, along with baby, there's a lot of blood loss also the mother goes through. So some kind of secretions or discharges will be happening. Like if you see in normal menstrual cycle, since most of you are female, I think you might relate that even premenstrual cycle and postmenstrual cycle, because of the hormonal changes, or immediately it will not just stop bleeding. There are some people who will have some kind of discharge which comes from the vagina, which is normal, right? The same way lochia is also something similar to that. So it starts from like blood color, and gradually as the days progresses it will be lightened and it will be like normal whitish discharge. Okay, so that's about lochia. So now let's see what are the physiological changes that we can see in postpartum period. Okay. So talking about the hormonal changes first. So hormonal changes, there is progesterone, there is estrogen, there is HCG, and there is one more hormone known as the relaxin hormone. Okay. So progesterone, let's talk about progesterone first. So progesterone would be increased, right? Someone read me note 10S. You had asked me to take it slowly. Is it okay now? Okay, fine then. So moving on, talking about the progesterone. So progesterone, as we know, we would have learned it in our ovulatory cycle that it is produced by the corpus luteum. So corpus luteum is nothing but it is a temporary gland which is found in the ovary. It surrounding our egg, you can say it is formed. So progesterone maintains the pregnancy. It helps in forming the lining of the womb. It helps in preventing any type of early contraction. It helps in maintaining the tone of the linings of the uterus. So that is the job of the progesterone. Okay, major job is this. Next, talking about estrogen. So estrogen is also initially produced by the corpus luteum. So after it is produced by the corpus luteum, even the placenta forms the estrogen. So estrogen level rises towards the end of pregnancy. Why? Because through the end of pregnancy, the placenta gets even more developed. Fine. So this will help in having, like, it will help in the growth of the uterus so that the uterus can accommodate a fetus. It will also help in having a vasodilatory effect by which there will be increased blood flow to the uterus. Okay, that is in short about estrogen. Now talking about the HCG. So HCG is the first hormone to be released by the placenta. So in our pregnancy test, right, we add some amount of urine to this thing and then we test. So in that, the first indicator is the presence of HCG. Okay, it's measured in pregnancy test. Okay, so that is a signal that the woman is a pregnant mother. So next, talking about relaxin. So relaxin helps in, like as the name says, relaxing the pelvic ligaments, softening the cervix, and it helps in also like aiding in the uh, expulsion of the baby. Okay. So next, talking about the uterus. Any doubts about the hormonal changes?
No, ma'am.
Okay. So
Ma'am,
talking about the uterus, as we all know, as a pregnancy progresses, the uterus will now start leaving the uterine cavity and then start entering the pelvic cavity, right? So, like it will ascend to the abdominal cavity. So the abdominal contents also slightly gets displaced, and then there is a lot of stretch which happens to the uterus to accommodate the fetus. Along with that, as I told you, there are hormones which will help in vasodilatation so that the uterine blood flow will be more. So next, talking about the cervix. So cervix, what will happen is during pregnancy, there will be enlargement of the mucus glands of the cervix, and they will secrete something called as the operculum. So operculum is like a seal. So now, if this is your vaginal opening, for instance, this operculum will be secreted and will be present like this. You can just imagine like this. So it is like a seal. No infections or anything will enter from here. Plus the baby is also supported in this manner. It's like a seal, it's like a door. Okay, just imagine it like that. So until this relaxin and all is secreted in excess amount, this operculum will be there. So your initial signs of labor can be a sudden discharge of a substance, which is the operculum. Fine. Now talking about the respiratory changes and cardiovascular changes. So obviously these two comes hand in hand. There is no keeping them apart. So as I told you, there is increased vasodilatation. There is a fetus to which you have to give blood supply and everything. So there's an increased blood volume, increased cardiac output, increased heart rate. There are blood pressure variation. Varicose veins can be formed. Why? As I told you, it will leave the abdominal cavity, it will leave the pelvic cavity, and it will enter the abdominal cavity. That the inferior vena cava starts get compressing a little bit. So because of that, varicose vein can happen because of peripheral vasodilatation. Next, talking about the respiratory changes. So obviously, if the blood volume, cardiac output, heart rate, and all increases, the tidal volume and the respiratory rate also would increase. So that's about the cardiovascular and respiratory changes. So talking about vagina is a muscular layer, so it will become very thick and it will become elastic, so that it will help in facilitation of the delivery. Okay. Any doubts in this slide about any of these changes? Can I move to the next?
Yes.
Yes, ma'am.
Okay. Okay, thank you.
Ma'am, some students are saying to explain it little bit slowly. So
Yeah, okay. I thought I'm explaining it a little slower. Okay, I'll go even more slow.
yeah,
So,
okay.
which all topics do you want me to take slowly? I'm sorry, I speak a little fast. That's my normal speaking, so I'll definitely slow down. I'm sorry. Which topic do you want me to repeat? Or I'll just say a gist of everything, or operculum and hormonal changes. Okay. So first talking about operculum. So in the cervix, the mucus glands get enlarged. So when the mucus glands get enlarged, they secrete a mucus plug. That mucus plug is called operculum. So the job of the operculum is to prevent any infection or any kind of activity from the external world to the uterus. So cervix is like this, for instance. The operculum would be formed like this, which is like a door kind of structure, which will prevent anything from entering or exiting. So it's like a door for the baby to be grown inside safely. So that is about operculum. About hormonal changes. Okay. There are 4 hormones: progesterone, estrogen, HCG, relaxin. Okay. I'll tell you a gist of it. So talking about the relaxin first. Relaxin, its job is to cause relaxation of the pelvic ligaments, soften the cervix. Okay, if the cervix soften means labor will take place. Okay, labor will initiate with relaxation of your cervix. Next topic, talking about estrogen and progesterone. So estrogen and progesterone are both produced by the corpus luteum, and estrogen is later on produced by the placenta also. So estrogen's job is to stimulate the uterus so that the fetus can grow inside. So for that you need increased blood supply to the uterus. There will be vasodilatation which will occur to the uterus. So all that job is done by the estrogen. Next, talking about progesterone, it is formed by corpus luteum. It will help in maintaining the lining of the womb. The endometrial lining is maintained by the progesterone. It will maintain the tone of the uterine muscles. So that job is done by progesterone. So HCG, it is the first hormone which is released by the placenta, by which we can, measure, that is measured in the pregnancy test. It is a signal. Okay, and if HCG is produced, that means the placenta is produced, which is an indication that the woman is pregnant. Okay, any doubt? Is this space okay, or am I again fast?
Okay.
Okay, this space is okay, fine. Can I move to the next? Is there any doubt? Clear, okay. Okay, so I'm moving to the next. So talking about postural changes and articular changes. So postural changes, as we know, lordotic posture is common. Why? Because the center of gravity changes. So usually the center of gravity, okay, let me just draw a stick figure. The center of gravity lies between our feet. You can say so in the ground level. Okay, so it is shifting. Why it is shifting? There is a curvature here, right? So based on this, the line of gravity will shift backward. So once the line of gravity shifts backward, to maintain that, a lordotic posture is maintained. Along with that, lateral sway can also be seen in the mother. So these changes can happen even postpartum, postural changes, because 9 months they've been adapting to this posture. Suddenly, in one day, just after delivery, they will not come to normal posture. They will have pain after delivery. They'll still have some floppiness in their abdomen. Could you please repeat? Okay. So the overall equilibrium will alter. How it will alter is definitely there is a baby which is fetus which is growing. Weight changes are happening. So because of this, the center of gravity of the body will go posteriorly. Okay. So once of the center of gravity shifts posteriorly, okay, instead of falling correctly between the feet, to compensate that only they're going for this lordotic posture. So these change along with this lordotic posture, they also maintain a kind of lateral to medial sway. You would have noticed if you see pregnant women walking, they sway sideways with lordotic posture, exactly like this. They'll hold their back like this and then they will walk, right? So this is seen even after 8 weeks of pregnancy. Okay, why? Because immediately after birth, it is not necessary that they will come back to normal posture. They still have floppiness in their abdomen. Their abdominal muscles will be extremely weak. Their back muscles would be weak. Their flexors, hip flex extensors would be weak. They'll go to a lot of emotional as well as psychological changes. They'll have a lot of pain. So their postural changes will last for at least 8 weeks of delivery. It is our job to correct it postpartum. Okay, clear, Bhumika? Bhumika, is it clear? Yes, okay. So, talking about the articular changes. So, earlierly, I had discussed that relaxin and the other hormones, all of this will help in relaxing the article in the cervix and the ligaments and all. So, how does it do? It is by changing the collagen metabolism. So, the laxicity is because the collagen will break down, and instead of that, it is replaced by a high water content, so the extensivity of that would be more. So what will happen is the ligamentous tissues will have laxicity, and it is seen in the peak during the second trimester. That is why all this pain and everything will come. Okay, so this can be seen 6 months postpartum also. That is why our job is important even in postpartum period. Clear? Any doubt? Can I move to the next? Clear. Okay. I would like all 60 of you participants, or at least 50 of you, to reply. Okay. So next we're going to talk about the fetal positions. So fetal positions is very, very important to know if we can, give exercise for the mother or not give exercise for the mother, basically. So fetal positions, there are 1, 2, 3, 4, 5. It's to have an easier understanding. You can consider these two is one position. Okay. Your three types of breach as one, and your transverse lie is one. So totally you will have three positions to remember. Okay. So in occiput or cephalic anterior, it is the best. It is the best fetal position. Okay, so in that the fetus will be in head down position. Head down, and the face of the baby would be facing the spine of the mother. So that is what cephalic anterior or occiput anterior means. The occiput of the baby will be in front, inside the tummy. Okay, that is occiput anterior. Next is occiput posterior or cephalic posterior. So cephalic position, that is head down position. Cephalic means head down position. Okay, cephalic position of the fetus. That is the mostly you will see that only in the ultrasound. You will not see with cephalic anterior posterior. Mostly they'll mention if the baby is cephalic or if the baby is in breech or if the baby is in transverse line. Okay, but theoretically speaking, there are these many positions. Now talking about cephalic posterior occiput procedure, it is also known as sunny side up position of the baby. Why? Because the baby will be in head down position in your uterus, but it will be looking outside. Okay, that is towards your tummy. Fine. So in this case, also vaginal delivery is safe. It is not that it is unsafe. Fine. Next is talking about the breech position. So there are three types of breech: frank breech, complete breech, and footling breech. Okay. So in frank breech, what happens is the normal good position of your, please repeat. Okay, what should I repeat? I'll just complete this once and I'll repeat it, okay, so that the others can just have a continuity. Yeah, I'll come back to you, Sona. So in frank breech, what will happen is the butt of the baby is towards the birth canal. In this position, the hips and knees are also flexed towards the face. So it's like the baby is completely compressed and the butt is towards the cervix. In this case, it is difficult to have a vaginal delivery. Difficult as in if they are having frank breech till the third trimester. Fine. I'll tell you why I'm telling you this also. Till the third trimester, if they're in breech only, it is difficult to have vaginal. Okay. Next is complete breech. In complete breech, again, the buttocks are towards the vaginal canal and the hips and knees are flexed. Next, in footling breech, the foot is towards the birth canal. Fine? That's about the breech position. Next, in transverse, let the baby is in transverse position. Fine? So I had pictures for it, just a second. Yes. So this is your cephalic position, breech position, and transverse position. In cephalic, head down position. In breech, this is the normal breech position, and then transverse line. Fine. And I'll repeat for you, Sona. Any doubts for anyone else, please put in the chat box or you can unmute and ask. So basically, you can divide it into three positions. Okay, one is breech, one is transverse, and one is cephalic position. Cephalic position, you can further divide into cephalic anterior and cephalic posterior. Later at the end, please what you explain. I'm hearing you from fetal position. Okay, Vijaya. Okay. So cephalic anterior and cephalic posterior are two types of cephalic position. So it is head down position, baby is facing the spine of the mother, it is cephalic anterior. Head down position, baby is facing the tummy of the mother, it is known as cephalic posterior position. In breech, the buttocks of the baby is towards the birth canal. So in such case, when the hips and knees are flexed, it is known as complete breech. If the hips and knees are in extended up position, it is frank breech. And in footling breech, one foot will be in the birth canal. Then transverse lie is the fetus is lying transversely in the uterus. Clear? Clear, Sona? I've repeated it for you. Yeah? Okay. So next we are going to talk about placental positions. So in placental position, placenta is a very temporary organ which connects the baby and the mother. It is immediately formed after conception and attaches to the wall of the uterus. This is the basic understanding for us. So just as how we saw, we have fetal positions, we have placental position. Again, this is important. Why? So that you can give according exercise prescriptions. So there is posterior placenta, anterior placenta, fundal placenta, lateral placenta, and placenta previa. So placenta previa is very alarming and it is contraindicated for physio management. Okay. So placenta previa, you should be careful. In posterior placenta, as the name suggests, the placenta will grow on the back of your uterus. Anterior placenta towards your abdominal wall, the placenta will grow. In fundal position, on top of the uterus, it will grow. In lateral position, in lateral walls of the placenta, it will go. So if you can see, I've mentioned the point that the placenta will move up until 32 weeks of pregnancy. Okay. If you remember, I had told you in the previous slide that in breech also, it is not contraindicated for us. You can, a normal vaginal delivery is possible in breech till 3rd week of pregnancy if it doesn't rotate. So, to make it clear for you, inside the uterus, with physio management, we can make the baby rotate. Okay. So even if the baby is in, or the fetus is in breech presentation, up to 32 weeks of pregnancy, you can definitely try. That is till the end of 2nd trimester also. You can definitely try to rotate the baby inside and have the mother have a normal vaginal delivery. Okay, so along with that, lateral placenta can also be corrected or it can be moved up. Fine. Placenta previa is low-lying placenta. So it is that if this is your cervix and this is your uterus, just for instance, this part the placenta is there. So how can you have a normal vaginal delivery? The baby has to push through the placenta. So if the baby pushes through the placenta will rupture, which will cause bleeding. So your baby cannot be born alive. Fine. So that is about placenta previa. It is contraindicated for us. There is no physio management. There is no rotating of the uterus or anything in this condition because it is highly risky. Okay. Any doubts? Can we start on the exercise? Can you express fundal and lateral? Okay. Can you explain important terms in Hindi also? What terms, sir? I'm not really sure of what. Do you just tell them to like put it in the chat box what they want me to explain again? I'll explain to them in Hindi, no issues. So, Shibi, you had asked about fundal and lateral positions of the placenta. Fundal is like suppose your uterus is there. On the roof of your uterus, if your placenta is positioned, that is known as fundal position. Lateral means on the lateral walls of a uterus, it is going and attaching the placenta. It is lateral placenta. That's it. So, what should I explain again in Hindi? You can just let me know. Any doubts, anyone? We're going to begin with the exercise part. That's why I'm asking. Clear. Okay. No. So just let me know what topic should I explain in Hindi. I'll definitely do that. Okay. Okay. So talking about antenatal exercise. So as we all know, when we learn any topic, we know about the aim of the exercise, the goal of the exercise. The same way in our antenatal exercise also we have a goal. The goal is to improve the physical and psychological well-being of an expected mother for labor and prevent any pregnancy-induced pathologies by physical means. So what type of this thing it will include? It will include aerobic exercise and strengthening exercises. Okay. So let's talk about a guidelines which says 150 minutes per week exercise is the minimum which a mother should do. That is about 20 to 30 minutes daily in moderate to vigorous aerobic intensity. This is as per guidelines. So shall we move forward?
Moderate weightlifting or aerobic only?
Sorry, ma'am, I didn't get you.
So weightlifting can be done by women.
We'll discuss about in detail. Yes, moderate amount of weightlifting is done. Moderate aerobic, moderate stretching, and moderate strengthening is advisable.
If
Okay,
any athletic woman who has already habituated to lift more than.
yes, we can train them according to it, no issues. I'll discuss about it later in the slides. It's just an introduction, ma'am. If by the end of the antenatal, if I didn't clear your query, you can come back to me, okay? I will definitely discuss about this. Can I move forward now? I think Dr. Aisha.
Yes, sorry to disturb you.
No, it was not a disturbance. No issues. Okay. So let's see what are the advantages of doing this antenatal exercise. Like, it is very, very difficult to educate the patients, not just the patients, even if you're working in a hospital sector or to gynac. that antenatal exercises are important. It prevents a lot of things. There are so much that can be done. So the education part is a really difficult thing to do. So it depends on our convenience capacity to go about it further. So the basic advantage is that it will reduce your morning sickness, it will reduce insomnia, it will reduce anxiety and stress. It will prevent many complications like your complaints, sorry, as fatigue, leg cramp, edema, pain, round ligament pain. Okay, it will prevent excessive weight gain during pregnancy, which causes many other complications. It will improve the strength, core stability, your muscle length and flexibility. It will prevent contractures. It will improve your posture. It will enhance relaxation and will prepare the mother for the physical demands of labor. Labor is physically demanding. Okay, so it will prepare that to a certain extent. Excuse me. Uh, Okay. Next, let's talk about the contraindication. So, as in all physiotherapy, we have an absolute contraindication and then we have a relative contraindication. So, talking about the absolute contraindication, any ruptured membrane is absolutely contraindicated. Premature labor. So, if you know that the labor is like is going to happen premature and there are so many complications, you just don't have to straight them over with exercises. Placenta previa after 28 weeks of pregnancy, as I told you, placenta previa is a big no for us, but you can do a little bit and try to rotate within 28 weeks of pregnancy. After that also, if it is a low lying placenta, for any reason, it is better that you do not touch the client because it gives a major chances of placenta previa. Also, if the case of placenta previa before 28 weeks itself, the doctor has suggested bed rest, which is the most important thing for the placenta previa mother. Please have a conversation with the gynecologist and get their opinion and consent before starting the exercise program. Talking about preeclampsia. So, anyone who can tell me about preeclampsia? Many would be knowing it. In the chat
Ma'am,
box,
am
or you
I
can
audible? Ma'am,
Yes,
I'm
you're
audible.
audible.
Ma'am, increasing blood pressure with more
Yes.
than 180 and 120.
Yes. So, to be precise, thank you. Thank you, Maitra. So, to be precise,
Thank you, ma'am.
preeclampsia is constant increase in blood pressure, not any fluctuation in blood pressure. Because there is something called as gestational diabetes, there is something called as gestational hypertension, and then there is preeclampsia. So, how do you differentiate preeclampsia from gestational hypertension? Is based on the frequency at which you are seeing high BP. Constantly for weeks together, you're just seeing high BP. There is no drop. That's like the normal BP itself is so high, means you can consider as preeclampsia. Okay. If it is gestational hypertension, it is again increased in BP, but there will be little fluctuation at least once a day. Like that, you can say it is this gestational hypertension. Next is incompetent cervix. So for incompetent cervix, it is basically that the cervix is not competent enough to hold your growing fetus. Okay. So let's say like your cervix is weak. In that case, it is known as cervical incompetence. Next is uterine growth restriction. If there is any tumor or something like that in the uterus, along with that, there is a fetus growing, you can just give a contraindication for your exercises. High order multiple pregnancy. That is like first time they're having twins, you can give them exercise. Second time they're having triplets, you can give them. But as it goes, the complications increases. Like a high order multiple pregnancy mother would definitely have any other contraindication also along with it. So you should be a little careful. It's better that you do not give any kind of exercise which gives strain on their uh, pelvic floor muscle, because there are chances of the pelvic floor muscles to be extremely weak. Fine. And if they have uncontrolled high blood pressure and diabetes and thyroid, uncontrolled means even after medicine they're having high, only then you can contraindicate. Then any other type of serious issues, cardiac issues, respiratory issues, you can contraindicate them. Relative contraindication, recent pregnancy loss or recurrent pregnancy loss, both. Okay. So it's not that they had a previous pregnancy loss and now they've come to you you're contraindicating them. No, you can give them, but you have to like be a psychologist along with a physiotherapist for them. Okay. And you should be careful while dealing with it. You should know the reason why they had any previous pregnancy loss. Was it because of the cervix? Was it because of the placental issue? You have to check all the previous history. Sorry. Talking about gestational hypertension. As I told you, gestational hypertension is relative contraindication. You can, like how we, normally see clients in other departments of hypertension, we just monitor the BP and make sure they're symptomatically okay, and then you can go with the exercise for them. If they had a history of spontaneous preterm birth. Again, for this, you'll check the history, why they had a preterm birth, why was it spontaneous, all the reasons you will check. And if you feel it is okay, it is not because of, any muscular factor, you can still go for exercise, means you can go ahead, no issues. It's relatively contraindicated. Maybe you can give some strengthening and you can stop stretching, those kind of things you can do. Next is any moderate cardiovascular or respiratory disease. That is like something like asthma and all. You can still go with exercise because asthma is common, right? Many people have it from childhood. Just because they have asthma, that doesn't mean you contraindicate them. Now, is my voice clear, Bhumika, or is it breaking for all of you?
Clear, ma'am.
Clear, okay. Bhumika, just check your connection. I've connected to my Wi-Fi, which is okay, I think. Okay. Next, we're going to talk about malnutrition. So, malnutrition, why is it contraindicated? Relative contraindication means if you have malnutrition, there is extreme weakness for them. So, in weakness patient, you don't have to go and stretch them more. Your concentration will be on this thing. What is it? Strengthening. Can you guide a pregnancy with SLE? Yes, I will discuss to you with this by the end of the session about SLE. I'll just go and complete the antenatal postnatal and get back to you. This is you can go SLE, you can go with normal exercise, there's no issues, but I'll definitely give you in each exercise how can you go with it. Fine. Next is any eating disorder. Why eating disorder is relatively contraindications? Again, because of malnutrition, obesity factors, they can have some cholesterol levels. So, with all of this, we will see and then only give for eating disorder. Twin pregnancy after 28 weeks. After 28 weeks, for the first session, they're coming after 28 weeks, means you should be careful because it's in the third trimester. And any other significant medical condition which you feel you can contraindicate, like a normal physiotherapy contraindications, it's similar to that. It's basically half of it is common sense and rest half is in clinically. Okay, can we move to the next? In case short cervix patient, doctor advise no bed rest, do follow exercises, ma'am. Yes, for shortening of cervix, you can follow exercises because the cervix is short. It is not weak, so it can hold the baby. You can go for exercise. There is no issue. Any other doubts, or can I go? And moving to the next. So now we're going to see trimester-wise exercises. So before that, let me make this clear. There are many settings as physiotherapists where we see antenatal mothers. So it can be an OP setup, an outpatient department, it can be an inpatient department, it can be a clinic, and it can be your house visit. Okay. So in first trimester, as we saw, the fetus is developing. The or to say the placenta is in developmental stage. Hormone changes are there in the mother. So we do not go for exercises which put extreme pressure on your abdomen. Okay, so what we do is we concentrate on upper limb and lower limb exercises with mild level of abdominal exercises. Okay, that is the goal for first trimester. Fine, because they're just beginning. So mostly if you would have heard in village side or like, your dada nani or your old generation would have said, first trimester you should be very careful. Please don't do anything. Just take rest. Just take rest. Why? They have relatively very low normal energy level. Okay. So what they say is you take rest, don't strain yourself because it's answers for you because the placenta is still attaching. the umbilical cord is developing, the fetus is developing. So you need to take some time to give the time to the mother to let all that happen. You cannot, in the first trimester itself, you do cat and camel, you do mountain climbers. Don't make her do everything. You have 9 months in your hand to train her. Okay. So first trimester, we can go a little slow on them. Fine. So you can go for light to moderate exercises, which includes, mild amount of stretching, strengthening to maintain good postures and everything. So before, like I tell you the first trimester exercise, if you see the patient in OP, what you would do? You will have a pamphlet with you, which you will tick mark and give them. They may follow, they may not follow. That is one case which I'm describing about. Next is an inpatient. Maybe for 1 or 2 days they'll be there. When you are there, you will go and then you'll teach them exercise. That's it. They'll follow or not, we don't know. The best to have these antenatal clinics in the antenatal patients in clinics. You can ask them to come to your clinic and do exercise on a regular basis. You can give them as a package. This I'm talking as a physiotherapist point of view. You can give them a package for 9 months or something like that. You can do. I'm just giving you an idea. And if you're going for home visit also, in first trimester, just because you're doing a home visit, please don't make them do any kind of excessive exercises. It's just a request. Fine. Okay. So I told you you have to avoid exercises which gives extra burden to your abdomen and pelvic floor. So with all of your assumption, what all exercises can we give in the first trimester? Let me see, from my teaching, what have you understood? And I'll definitely tell you the exercises which, you can prescribe. Yes, can all of you just give me your insights? First trimester exercises. I gave you a clue, exercises which does not give excessive pressure on your pelvis and abdomen. Yes, Pooja ma'am.
Breathing exercises can be incorporated.
Yes, good.
Breathing exercises, lower limb stretching exercises, exercises in side lying position, like
Okay, good.
side lying abduction, वगैरह.
Ma'am,
Okay, fine.
massage can be done or
Massage can be done. Yes, yes, you can.
for relaxation in that, because at first trimester
Yes,
stress
Aisha,
also.
you can do.
Ma'am,
Okay.
bridging.
Bridging you can do. Okay.
Stretching is can be done, ma'am.
What type of stretching, ma'am?
Then they are typing. I want to know stretching can be done or not.
Yeah, I will discuss that. I'm just waiting for everyone to, just have a discussion with me. Upper limb shoulder girdle exercise, yes, you can do. Stretching exercises, please be specific what stretching. Range of motion exercise, okay. Brisk walking, okay. Breathing exercise, okay. Child pose stretch. Okay, so child pose stretch, as I told you, you have to have decreased amount of pressure and strain to your pelvis and abdomen. So child pose stretch, even though it is, focusing on certain other group of muscles, it will indirectly affect your abdominal region. So you have to be a little careful. Ankle toe movements, okay. Basic neck stretching, strengthening shoulders, okay, good. Okay. So I'm happy that, most of you have an idea about it. So in stretching of the lower limb, we should be having this thing in mind that we should not stretch the inner thigh muscles, like, our butterfly stretch and your lunge stretch, we can avoid in the first trimester. So as I told you, this trimester lasts up to 17 weeks of pregnancy. So I am not telling you till 17 weeks, only do range of motion and upper limb stretching and all. No, progressively do it. But that progression should be slow, not like in our orthopedics, what we do. We progress it like in, isometrics and then directly strengthening manual resistance, and then you'll put on weights and you'll put on TheraBands and you'll, discharge the patient. No, here you have 17 weeks in hand to progress. So you should progress accordingly. Fine. So as we discussed, you can give deep breathing exercise. We can do thoracic mobility exercise, ankle pumps, pelvic curls, hamstring stretch, bicep stretch, brisk walking. Okay. Along with that, you can also, do pelvic tilts and pelvic curls, as you can see in this picture. In any of this, you have a doubt, please stop me immediately. I will demonstrate the exercise to you. Since most of you are plus third year and all of you are in working, I am assuming that you know these exercises, but some exercise which you have any doubt, you can definitely ask me. So before I go on with describing about the other exercise, let me be clear about the breathing pattern which we should teach during all the 3 trimesters. So mostly what we do while exercising is we'll breathe in during exercise. If you've noticed, our fitness educators and everyone will say you breathe in during the exercise. In your pregnancy clients or your pregnant clients, it is the opposite. Okay, I'll demonstrate it to you. Just a second. Yes. So I'll just turn on my camera. So your breathing pattern is your normal pursed lip breathing. But how? You need to breathe in through your nose and breathe out via your mouth. That's pursed lip breathing, right? Or diaphragmatic breathing. That is the normal breathing pattern. So you'll breathe in through your nose and breathe out via your mouth. This is the breathing pattern that we will follow, correct? So, for example, we're doing any exercise, like suppose, let's say, just a second. So suppose I am telling you we're doing biceps curls. So biceps curls is this. So I'll breathe in, and while breathing out, I'm supposed to do the exercise. So breathe in, breathe out, and flex. Again, breathe in, breathe out, and extend. So I'll demonstrate for you without me speaking. So okay, this is how you do exercise in your antenatal phase. So be it any minor exercise, if it's your neck range of motion. So you'll breathe in, breathe out, and look up. Again, breathe in, breathe out, and look down. If it's sideways, breathe in, breathe out to your side. Again, breathe in, breathe out to the middle. Breathe in, breathe out to your side. Breathe in, breathe out to your middle. So this is just example of 2 exercises I'm doing. So any other exercise, you have to follow the same pattern. Like for example, you're doing bridging, let's say. In bridging, you will breathe in, and as you breathe out, you will lift your pelvis, okay? And again, you will breathe in and breathe out and keep your pelvis down. So this is a breathing pattern that should be followed in antenatal mothers. So some of you have asked, how do you do pelvic curls and how do you do thoracic mobility exercise? Okay. So talking about thoracic mobility exercise, your hands would be in front. So breathe in, breathe out, and open up. Again, breathe in, breathe out, and close back. This is one thoracic. A normal thoracic exercise is what? This is our thoracic expansion exercise, right? In this, we are doing the ulta of it. So you'll breathe in, breathe out, and open your arms. Breathe in, breathe out, and bring your hands together. Same way, hands down. Breathe in, breathe out, and up. Breathe in, breathe out, and down. Same way, sideways. Breathe in, breathe out, and up. Breathe in, breathe out, and down. Okay. Next, you had asked pelvic curl. Tilting exercise. So in clear. So in sideways, if you can see, if this is your pelvis, again front and back. This is pelvic tilts, front, back, and sideways. Yes? Any doubts? Okay. Can you repeat tilt, curls? Okay. Tilt and curls I need to repeat, right? Okay, I'll do it in standing so you can have a better this thing. Anything else in the chat box which I have not answered? Why breathing pattern is changed in antenatal phase? So you need most of your oxygen and other supply to your abdomen. So if you perform exercises while you're breathing in, you are actually engaging your core muscles. So you don't have to engage your core muscles to a certain extent because you have to give enough oxygen to your fetus also. That is why this type of this thing is advised. Here. So now, okay. So pelvic curls are basically your pelvic bridges. Pelvic tilts is this, okay? Your pelvis in normal neutral position, going forward and backward. You can see me sideways, forward and backward. This is one kind of tilt. Another tilt is sideways, forward and backward, in forward and backward. It's not literally lifting your hip like this, it's just your pelvic movements. Yeah? This can be done in standing, and it can also be done on your Swiss ball or your birthing ball. Fine? Any doubts in pelvic curls and pelvic tilts?
Clear, ma'am.
Okay.
Thank you, ma'am.
So, no issues. No issues. So, in your first trimester, we'll be dealing with these exercises. Along with that, you can, deal with any lower limb exercise. Like, it can be your toe standing, it can be your any exercise which does not give strain. So, you got the concept, right? You're not supposed to strain your abdominal area. Again, I hope my screen is visible. Okay. Clear. Can bridging be done in a first trimester? As I told you, first trimester you will slowly progress. So suppose now you have a 1 hour session with the client, that's the maximum, right? Obviously, OP, we'll just give them the leg stuff exercise, tell them to do. So the maximum time we spend with the client is in clinic or when you have home visit. So you'll have basically just 1 hour. You don't have to do the 12 week, which is in the first day. You can go with your normal exercise, thoracic mobility, neck movements, biceps curls, triceps curls, wrist stretches, ankle toe movement, toe standing, hamstring stretch. There are so many to do. So you can progressively do it slowly, day by day. In the first week, second week, don't do bridges. Do it by 16, 17 weeks. No problem. Okay? The thing is, with antenatal, there is no strict protocol that needs to be followed. So it is based on your client and how their physical status is. Suppose your client is athletic. Someone had asked, right? Athletic. So athletic means you can do 1 week to 2 weeks normal exercise, just like a warm up, and then from next day give them weights. Next day give them TheraBand, TheraTube. All the exercises can be done, right? Whatever exercise you can do for upper limb, you can do. There is no issues. It is good. It will improve the thoracic mobility. It will decrease the chances for any shoulder tightness. It will strengthen the shoulder muscles, because once they have a postpartum period, they have to lift the baby, for which they have to train the shoulder muscle. So it is all helpful. First trimester clear? If you understand the antenatal exercises, trust me, postnatal exercise would be very easy. Because all we're doing is focusing on the pelvic floor. So how there are only 2 muscles in the pelvic floor, that also you can't deal with separately. So it's your creativity how to deal with these exercises, right? So I'm just giving you a rough idea. Definitely I'll give you some idea to, think outside the blocks. That's why I'm asking you to be interactive with me. So now you would have got an idea, first trimester, what all can be done. See, even while seeing clients, you're having any doubt, you can just put a message to me on the WhatsApp group. I will get back to you. Maybe not immediately, but within 24 hours, I'll get back to you. And let me be clear that if there's any articles or anything that you are reading that which is valid, you want to share regarding obstetrics and gynecology and antenatal postnatal, please share it in the group. The group would be kept even after the class. I'll also share whatever I'm reading. So, you can have a discussion with me anytime. Fine? Can we go to the second trimester?
Yes, ma'am.
Okay. Clear. Fine. So next we are going to see the second trimester exercise. So as I told you, it starts from 18 weeks to 28 weeks. Again, stretching, strengthening and all will happen. And as we spoke in earlier slides, the common complaints are low back pain, pubic pain, leg cramp, fatigue, thoracic pain. So we have exercises for all of this. So now since we're going detail about the exercise, if any of you want me to check on how you're doing the exercise, is the breathing pattern correct? Please be free to, open your videos and show it to me. I'll definitely correct you. And if you want to discuss any exercise to add on, please show it to me so that I'll have an idea. I can correct you then, right? Okay. So first, let's see as OP therapist, what all exercise can you give in second trimester according to you? Please put it in the chat box or unmute and say. What all exercises can be done in second trimester? These are the complaints, right? So as physiotherapists, we know for leg cramps what to do, lower back pain what to do. So at least those exercises, please put in the chat box. Thoracic pain what to do. So why thoracic pain comes in second trimester can be one of your queries. So constantly they'll feel the baby moving, their abdomen is increasing. So their thoracic expansion decreases. Along with that, they might complain, my baby is kicking on the ribs. I feel my ribs are completely bruised. So because of that also thoracic pain can be there. Yeah. So second trimester exercises, what all can be done? Slowly we can give core strengthening, very good. Would you like to turn on your video and show it to me, Disha? Any one exercise, if you can demonstrate, I can correct it to you. Why groin pain? Okay, I'll explain that to you. Pilot exercises. What do you mean by pilot exercises, Suganya? Bridging, yes. Why groin pain is because can we give pelvic floor contractions and core activations in the first trimester? Core activation as in pelvic floor contractions, are you meaning Kegels exercise? Kegels exercise, we need not start in the first trimester. If you start, nothing will happen, but it's better you start from the second trimester. I didn't get what do you mean by core activation, Ruchita. Pelvic tilting, good. Cat and camel, good. So pillet exercises, I didn't get you. I was answering someone's question. Transverse abdominal activation. What exercise do you mean by transverse abdominal activation? Let me know. Yes, I was answering why groin pain. So, as your pregnancy progresses, your uterus tries to dextro rotate a little bit. That is one reason. Along with that, I told you relaxin is getting produced. It will cause laxity. So, there is no strength in your ligaments and muscles. So, there is pain. Abdominal size is increasing. Posture is changing. Some muscles will go for shortening, some muscles will go for laxity. All of this will cause pain. And pubic pain, trust me, if you are a therapist who has seen the client from the first trimester, your patient will not have pubic pain throughout the pregnancy if she follows your exercise protocol correctly. It is an assurity which I can give you. But the same patient comes to you in the end of second trimester and complains to you with pubic pain. What you can do is you can stop its exaggeration, you can limit it to a certain extent, but it is very, very, very difficult to completely reduce it off. Pubic pain is very, very painful for the client, and the earlier they come and the earlier you give them exercise in the proper, correct way with the correct breathing pattern, they can have a pregnancy without pubic pain. Fine. Isometric exercises. Okay. Duck walking, no. iPhone 6, I'm sorry, I don't know your name. Duck walking, no. It is a big, big no. Second trimester, no duck walking. Low weight leg strengthening, okay. Bilateral exercise. Well, SLR, no. Unilateral SLR, you can. Bilateral, no. Belly button tuck in, hook lying position. See, this core activation is done in all the exercises which you told Ruchita is postpartum. Okay, not antenatal. Why? Imagine a mother, you would self imagine sitting with two pillows on your tummy in hook lying position. It's not easy. It's gonna create excess stress on your lower abdomen. That's why. Okay, just think of the best position within the most relaxed position to do exercises, or else they will not come to you. If they're not relaxed, they're definitely not going to come to you. And especially if you have clients, the same client constantly from the first trimester, second trimester onwards, you need to change your exercise daily, or else they'll get bored of it and they'll not engage in the exercise. And once they don't engage in the exercise, there is no use of doing physio in OG sector. Yeah. So it's your task to make it interesting for them. Okay, so most of you have given me your points. Squats is no. Second trimester, no squats. Again, no excessive pressure on your lower abdomen, Disha. Pectoralis stretch, yes, you can do. You can do it in the first trimester also. Upper limb exercise, you can do anything. No issues. wall push-ups you want to do, you do any stretch, any strengthening, no problem at all. So rocking ball hug exercise. Clamshell, yes, you can do. So you'll ask your mother to be in this position and rock forward, backward, side to side. This is rocking ball hug exercise. Why? Okay, in pediatrics or in our neurodevelopmental theory, we give rocking movements to the baby to reduce the muscle tension, right? Same concept is for rocking ball hug exercise. So you'll ask the mother to go forward, rock forward, backward, and sideways. So I told you you have to modify the exercise, right? So in this position, how can you modify the exercise? Just think and let me know, or else I'll let you know. We'll get an idea how to be creative with the basic exercise. How can you improve? Anyone who wants to demonstrate and show me, or at least tell me what variation you can do in rocking ball hug? Anyone?
You can incorporate her partner too during the exercise session.
Yes,
during
yes, you
second
can.
trimester.
You can. That partner exercise, okay. I'm asking in this, like, we are making them to reduce tension. But in the same position, you can do some other exercise which will, in the same position you can do back and forth with hip extension. They will lose balance if they do so. So we don't go for anything, where there is risk of fall disha. Unilateral leg raise. I think that's the same thing which Disha told. You can, but then the problem is the balance can be lost. So until as how I think Dr. Pooja said, we will not go for exercise. Like she told about the partner. If the partner is there, yeah, she can do hip extension, no issues. Back extension on the ball. We don't suggest back extension on the ball. Why? Because we even tell them not to go fully in supine position. So we do not encourage that on the ball. Side to side movement is somewhere close to what I expected. Cat and cow in this. Yes, but it is not that effective. So what I meant is you can go, the trunk flexion exercise is there, right? So that you can do. That you can be done in the first trimester also. Now also you can do. In the same rocking hair position, I told you they can go side to side now. So along with side to side, they can nicely stretch till the side, hold it, and then come back. Again, go till this extent, hold it, and then come back. Did you understand what I'm saying? Or you want me to demonstrate?
Yes, ma'am, please.
Okay, I'll demonstrate. So this is how I meant by, you should get creative with the basic exercises. So I'll do it on the chair for you. I think it will be clear. I have not inflated my ball, it just got deflated, that's why. Okay. So am I visible? Yeah. So this is your rocking ball hug position, right? So you rock them forward, backward, and then sideways. So this is kind of trunk lateral flexion, right? Am I visible and clear?
Yes.
Ma'am.
So this is our rocking hug position. We go forward, backward, and sideways on the ball in this position. Same thing, just hold the ball in this, go to the side. It is lateral trunk flexion stretch. Correct? Same way this side. The other side of the trunk is getting stretched. That's like a trunk extension exercise. Like we do this, right? Trunk. It's getting stretched. Same way in this position. If you do, it's again getting stretched. Am I clear?
Yes, ma'am.
Okay. So this is how I meant by you can, in the basic exercise itself, you can do variations like these. Can I go forward? Any doubts with this? The breathing pattern is you will breathe in, breathe out and go to the other side. Again, breathe in, breathe out and go to the next side. Okay?
Yes, ma'am.
So So coming back to it. Uh, my screen is visible, I hope so. So this is one exercise which is for relaxation. Next, let's see. Upper limb strengthening, I
Excuse me,
told
ma'am.
you. Yes?
Ma'am, I'm having a question.
Yeah.
Ma'am, suppose we're having a patient who have never been active and it's her
Okay.
second trimester and she is complaining of severe back pain. So in
Okay.
that condition, what exercises specifically should be advised to her and what precautions should we ask her to follow? And can we incorporate an exercise program to her as she was not active during her pregnancy at all? So please guide me
That's what.
about it.
Whichever phase the client comes to you, it is our responsibility to deal with them. So right now, I'm telling you, it is better that they come from first trimester. I'm telling as an advice. If the patient doesn't come from first trimester, there is nothing to be done. From whichever trimester they come, we have to manage them. Our normal pelvic bridges can be done. Back massages can be given. Inside lying abduction exercises can be given. Cat and camel can be given. So many exercises. Our normal back strengthening exercises can be given, back stretching exercises can be given, hot water pack applications can be suggested. But all of this exercise should be done with the correct breathing pattern. That is our concern here. Okay,
Okay, ma'am. Thank you so much.
no problem. So now upper limb strengthening, I was speaking about wall push-ups, right? So wall push-up variation is the Swiss ball. This takes into account their balance also. Fine. Same way, you can, even though they don't have a gym setup, you can just tie it in their windows and ask them to do this kind of pulls also. Can I go next? I'm telling you the basic exercise. If you seeing these pictures, if you think of some creative things, you can definitely discuss here. We all are here to discuss, right? All of us have finished BPT. We know what are these strengthening and stretching exercises. We just know how to do it and when to do it. That's what we're going to discuss here today. Yes, can I go next? So hip flexor stretch. So I told you in the first trimester, we are not going to give much stretch to the hip flexors, the inner thigh muscles and all. But second trimester onwards, you can. That doesn't mean if the patient is like, still very weak, you don't have to go for hip flexor in the first week of second trimester. Go by the second week, third week, strengthen it first, then go for stretching. So you will, this is like in lunges position, she's going for flexion, right? So in lunges position, she can just go for a mild stretch and come back. So she'll breathe in. As she pushes herself forward, she will breathe out. Again, she'll breathe in and come back. Okay, is it clear? So again, why hip flexor stretch is important is because the shortening will happen because the center of gravity changes. Some lady complained of lower limb radiculopathy and sciatica like pain. So what can we do? Piriformis stretch we can do. That's a not. We can't go and do traction in this case, right? So you can do piriformis stretch, calf stretch, ham stretch. You can do your see. The thing is, you can do your normal daily or OP. What all exercises we suggest we can give, but with the right breathing pattern, with the right caution, with the moderate amount of pressure. The entire thing depends there. And along with that, our major focus is the pelvic floor. Okay, I hope your doubt is clear, Aisha.
Ma'am, if patient has DVT.
DVT, it is contraindicated, right? So we will not go for that exercises. DVT is a normal contraindication for physiotherapy as a whole. So it
So
is
whole
contra-
pregnancy can't do anything, ma'am.
you can see mostly DVT happens in the lower limb. You can go some mild upper limb exercise or something like that. But
Okay.
DVT, you should be careful. And if it is DVT, they will have some drugs going on for it because they'll be pregnant also, right? So definitely they'll check all that. So
Okay.
based on that only, we'll go forward. You had mentioned in sideline position, hip exercise can be given in second trimester, but in sideline, we allowed us that is usually not given due to IVC compression. No, Ruchita, I think you have a misinformation here. Supine lying is not given for these reasons. Side lying is a position which pregnant mother is supposed to adopt. Supine lying is no, side lying is a yes. In fact, sleeping position, we tell them to adopt side lying positions, right? So I think you've got a wrong information with you. Second trimester or any trimester, side lying is advised. Supine lying is not advised.
Yeah, in pregnancy during position, we advise for the sideline position.
Yes, we do not advise supine. We advise side lying. You're right, Farheen. Am I clear, Ruchita? Can I go forward? Okay. So now we're going to talk about pelvic bridges. So pelvic bridges, as all of you know, is the most important exercise for your pelvic floor, your lower back, and all the muscles as a group. It is very important. So there are many variations of pelvic that we can follow. So first one is your normal pelvic bridges. You'll ask the patient to lay down, bend their knees, breathe in, breathe out, and raise their hip, come down. That's it. Do it for 10 times. Second one is pelvic bridges with hold. How you will progress the hold? 5. First hold it for 5. Then progress to 10-second hold. Next, what you can do? Pelvic bridges with TheraBand. How you will do it? You will tie a TheraBand around the thigh region. Ask them to now do normal pelvic bridges. That is the third one. Fourth one with Swiss ball. Like how you can see in this picture. Ask her to keep the back on this and then lift the pelvis. Swiss ball. Same thing. Now Swiss ball with hold. That too in progression, like how we mentioned here, from 5 to 10-second hold. Next, Swiss ball was under the back now. Keep the Swiss ball under the feet. Feet means under the calf. Here she'll keep the Swiss ball and like this she will raise her pelvis now. Under the Swiss ball. Now again, that Swiss ball with hold. Then Swiss ball with TheraBand. Yeah. So that's like nearly 8 to 10 variations of pelvic bridges we itself discussed right now. So in same way, as you see clients, you will get an idea of how to modify each and every exercise. So in pelvic bridges itself, yes, pelvic bridges is advisable in the second trimester. We are talking about the second trimester exercise, Diana. So pelvic bridges, these are the variations which we can do. Any other variations which you people can think of, do let me know. I will tell you if we can go for it or not go for it. Okay. Right now in second trimester, mostly the basic thing is no squats, no dog walking, no any sumo squats are not advisable. That's it. Apart from that, you can do exercises with moderate level of, this thing on your tummy. So that's about bridging. So with one bridges, we can do so much. So in second trimester, how to progress exercises is like, this is an example for it. First, you'll do this for 2 days, and the next thing for 2 days, another thing for 3 days, like that. So you can take your time and progress. Next is mountain climbers. Can hold Swiss ball also. Yes, you can hold Swiss ball. Someone has asked fire hydrant kicks. What do you mean by that? Maybe if you explain the exercise, I'll know, but I'm not familiar with this name. I'm sorry. Oh, are you talking about the, in that quadruped position, in that going and kicking back? Are you talking about that as fire hydrant? Pelvic bridge with single leg. No, it is like excessive strain. So which is something which is easy for them. Single leg and all is more difficult, plus the balance issue would come. They have to maintain the center of gravity. Already they have such a big abdomen to manage with. So this will get difficult. Okay, so now, yeah.
VMO, ma'am. Strengthening.
Yes, you can do VMO strengthening, no issues. You can go ahead with it with the right breathing pattern. So all this exercise is with the breathing pattern. Breathing pattern is very important. Please keep in mind, or else they will complain of cramp. Yes, Asra, you were saying something.
Yes, ma'am. In which position that has to be done? In crook lying or?
In sitting, you can ask them to keep the knee in like mid extension and then ask them to go for end range of extension. That's the best. Or else in sideline you can do. But as a progression, the best thing is to do in sitting. Crook lying, if their tummy, they're comfortable in crook lying means no problem. If they're not, means sitting you can do.
Okay, ma'am. Thank you.
No issue. Yeah, okay. So now talking about mountain climbers. So now you'll be asking all this time, I told you don't compress the abdomen. Now I'm asking you to do mountain climbers. In this picture itself, her abdomen is completely compressed, right? I'm not telling you to do mountain climbers like this. I didn't get the right picture for it, that is why. So you can keep both the legs like on the toes on the floor, and just the toe movements can be done in mountain climbers. Did you understand or shall I demonstrate it for you?
Yes, please, ma'am.
Yes, ma'am.
Yeah. So is my video visible? Yeah.
Yes.
Yes, ma'am.
So our normal mountain climbers position is this, right? This is a normal mountain climbers. We do it like this. So in this way, see how the abdomen is getting compressed. Are you able to see that?
Yes,
Yes.
ma'am.
Okay. So how you'll suggest them to do is just this. 1, 2, 3, 4.
Okay.
So in this way, the toes are intact on the floor. Abdomen is not much compressed. And it will give a good area for your baby to go down. Like in this position, the baby tries to come up to the upper area of your abdomen, right? So the lower area, they have enough and more space. Like if you can see again, in this position, the lower abdomen space is there for the baby. Yeah?
Yes, ma'am.
Is it clear?
Yes, ma'am.
Okay. Anyone would like to demonstrate the exercise so I can correct you in any way?
Ma'am, some
Yeah.
people will say that they are unable to do this mountain climb.
Yes, they will initially say they're
Yeah.
unable to do it. So along, I'm not telling like if the patient comes to you in the first day do mountain climbers. Gradually progress.
And along with this, can we ask them to do stairs climbing?
What? I didn't get you.
Stairs climbing.
Stairs climbing.
Yeah.
Like the normal stair climbing or
Normal.
they can do normal stair climbing. Are you saying stair climbing is an exercise or the normal that's climbing up and down the stairs?
Up and down the stairs.
Yeah, they can do no issues. They're not restricted from going up and down anywhere.
Okay.
Okay, so that's about the mountain climbers. Any doubts? Anyone who want to demonstrate this exercise, please go ahead and demonstrate. No one's gonna judge you here. Anyone who would like to demonstrate with the right breathing pattern so I can correct you or want to show any exercise? Okay, I'm going to the next topic. Sideline lifts. So this is what we were talking about. In sideline, you can ask them to go for lift. In this now, how do you modify? Same like your bridges, you can modify. Okay. You can add Terra bands, you can add Terra tubes. You can ask them to do it with hold. So some people will already have tightness. So initially they'll only do this much. You'll ask them to hold till this much. Then increase a 5 degree. Hold there. Again increase 5 degrees. Hold there. In this way you can do. Okay. Any doubts in leg braces? So initially you can start leg lifts in standing. In standing, just do abduction, adduction, then abduction, adduction with hold, then progress to side lifts. So that's like progression of it, right? So next we're gonna talk about Saharman exercise. So you can note down this name. If you note this down in Google, there are too many types, like how we have our SLR1, SLR2, SLR3, SLR4. There are group of exercises for Saharman exercise also. I'm telling you the one which we can follow to a certain extent in our OG. This is the initial position. Just ask them to bend their knees, extend one, keep it back. Extend the other, keep it back. This is a type of exercise. Exercise for hip locking. I didn't get your point, so please explain that to me, Rituja. So Saharman exercise is this normal in knees bent to a certain extent, just extend and come back, extend and come back. Okay, you can do this with therapeuts also. Many pregnant women train with weightlifting. Is it correct to do in second trimester? You can. I told you about biceps curls, triceps curls. We're doing tubes and bands. You can do 2 kg, 3 kg, but not like in the first day itself do 20 kg deadlift. No one's telling you. Basic 2, 3 kgs they can do. Okay. Next we had is it advised to place a pillow right hip during lying position? If yes, then why? In lying position, they don't have to place a pillow below their hip. I've not heard of it. They usually place a pillow while they flex a knee or something or under their neck.
Between the knees.
Between the knees, you're asking. Yeah, you can.
No,
Okay, I think
I'm
that's what he told. Okay, yeah, you can place it between the knees.
between the
I'm not below the right hip. No.
no, we are not advisable because here we are keeping only because for the blood circulation and no stretch only.
Yes. Right hip, I've not heard of it. I don't think it is done also. Why specifically right hip you've asked? Anything like that you've heard? Then if it is like that, it is a miscommunication. It's a wrong information. You don't have to. Okay. Okay. So we had discussed that they complain of low back. So we can go for pelvic rotation exercise. So pelvic rotation you can do it standing. You can do this thing, your Swiss ball, as you can see here. Then cat and camel and clamshell exercises. Sorry, there's a typing error here. Cat and camel exercises can be done. Seated straddle exercise. So I hope you're aware of seated straddle. Yes.
No, ma'am.
Okay, seated straddle is basically in this position, like you saw, right? They're keeping the legs apart. Like that in legs apart position, you do the movement. So seated straddle actually is they in this position, they lift both their legs up. We don't do that here. What we do is we ask them to sit in the V-shaped position and try to come forward. So it is technically not possible for them to come all the way down because of the belly, as you can see. To a certain extent, they can come forward and come backward. So this it will help in opening up the hip creases and all that. That is seated straddle. Piriformis stretch. So piriformis stretch you can do in sitting in the figure of 4 and press this knee down, or else in this position also you can stretch your hams in this position. In this, you can just ask to touch the toe. They will not be able to touch the toe again. The abdomen will be compressed. So the assisted one is there, right? We put a towel around the toes and we ask them to pull it. That can be done. And as we discussed, pelvic tilting and rotations. So that's about the lower back pain exercise. Yes, along with this, you can do your pelvic bridges, you can do your, cat and camel, wall bird exercise, all that can be done. Heel pain, all your plantar fasciitis exercises you can do. There is no doubt you can do all of it. Okay. This kind of stretch is what I was talking about. So in this position is not possible, right? Your abdomen will, like imagine this lady to have this much of abdomen. So it's not possible. So in V-shaped leg, the same kind of stretch you can do. Why heel pain occurs? So the center of gravity is shifting backwards, right? As I told you, relaxin hormone is getting induced. Excessive weight gain, sudden weight gain, which the legs have to bear, and obviously some amount of immobility also causes leg pain, heel pain, edematous feet. So all that will happen. So if with continuous, like if you're having a client, if you see them all alternate days also, this heel pain, edematous feet, pubic pain, round ligament pain, all that is not possible to be done. Can we give this exercise in DVT? No, we can't. See, for DVT, we don't give anything so that it doesn't get, dislodged and cause an emboli later on. So that's why we do not go for anything. Fine.
Yes, ma'am.
So now talking about pubic pain. So talking about pubic pain, this is one butterfly stretch picture which I've put for you. Okay, so butterfly stretch is very important. It will help you stretch all your inner thigh muscles and also the pubic area to a certain extent. Side leg raise. This is the clamshell. Again, seated straddles, feet and marching. All of this will help in pubic pain also. See, now itself you can see for pubic pain, clamshell is repeating for low back also. Your seated straddle is also repeating for low back. So as I told you, this entire, it's like a group of muscles you're training. It's not like a single muscle that you are training. That single muscle training is done for upper limb and lower limb. When once it comes to your pelvis and your lower back, it's like a group which we are targeting. Fine. Please explain which kind of prevention I take is to prevent complications. See, the complications which we can prevent is being careful with placenta previa and to prevent any contractures, hip flexor tightness prevention. Then, because they have to be in lithotomy position for delivery, right? So in those things can be prevented. Edematous feet can be prevented. Pubic pain can be prevented. So you're asking which kind of prevention you should take as a physio, your contraindications and indications. If you see that itself, you will get an idea. Low lying placenta you will not treat. Breech presentation, you will have a separate set of exercises which we will discuss about. So that's the prevention which you're supposed to take. Not the basic prevention is don't exert the patient so much like how you go for a sports training or an ortho training. Mild to moderate is our target. Pregnancy DVT patient, do go for upper limb exercise, go for thoracic expansion. See where the exact thrombolized area is. Based on that, you can give. Okay. Now we're talking about leg cramps. So in leg cramps, long sitting, hamstring stretch is the thing which we can do. We can also suggest for hot water packs and cold packs. That kind of normal conservative management can go. Going with thoracic pain, bow and arrow exercise. This is the bow and arrow exercise. This in the picture they're doing with the resistance band, they can do it without the resistance band also. So that will help in thoracic mobility and will also help in some kind of trunk rotation. And then wall and bird exercise. Clear? Any doubts? Can I go third trimester exercise?
Yes, ma'am.
Okay. Okay, I would like to mention Dr. Disha. I'm so happy to see you taking notes and listening to the class with your video on and everything. It really makes me feel happy. So thank you so much for doing that. What is wall and bird exercise? Okay. So your wall and bird exercise is this. In this position. So they'll be in quadruped position first. And the first one alternate leg and hand raise. So that is your wall and bird. Please continue to do the dish. I'm really happy. If you want, you can please demonstrate your exercise also. I'll be really happy to see that if you're fine with it. Okay. Any other doubts? Can I move forward?
Yes, ma'am.
Okay. Fine. So now we are going to see about just a second. Yeah. Now we are going to see about the third trimester exercise. So in third trimester exercise, what's our concern? We have to facilitate the normal delivery, or we should facilitate delivery. So one thing which I would like to say is, let's not, give instruction to our clients that, normal vaginal delivery is the best. Let's just do this. Let's not, go for LSCA. That's not at all good. Let's not do that. So just like how we have an option to tell the patient about conservative management and surgical management, let's keep it the same way for OG. It's the mother's choice, okay? So we can just give them advice, or we can tell them, see, in normal vaginal delivery, you will be, having the labor pain, you'll be in lithotomy position, you'll be pushing the child, maximum you will have an episiotomy done. So this is what will happen in normal delivery. And then you can see LSCS, they will be taking you to an OT. They will be, trying to open up your abdomen and have a view of your abdomen, and then the baby will be taken. There is no pushing phase. The labor pain can be controlled to a certain extent in LSCS, but they'll give you anesthesia and your spinal anesthesia is done. So it is just educating the client about the delivery. let's not give an imposition that, normal delivery is only done. If they ask you, like, what would you suggest? We'll say, let's try to do a normal vaginal delivery if the circumstances prevail. Like, you never know. Once the pelvic pain starts, they'll be like, no, it is not dilated properly. They'll go for an emergency LSC. So that time the patient should be like, no, I'm doing something wrong. That stress should not happen to your client at that time. So you should be very clear with that. This is what is normal delivery. This is what is LSCS. This is what they do in normal delivery. This is what they do in LSCS. Let them take a call on it. And whatever it is, like if you're seeing the case postnatal also, they have done LSCS, good. Let's do exercises based on that. They did a normal delivery, fine. Let's do based on that. Let's, have a speedy recovery from it. That's our concept, not on imposing anything on them. Fine. So in third trimester, you had asked about squats, duck walking, everything comes in your third trimester. So since I've mentioned only 3 exercises in third trimester, that doesn't mean if the patient comes to you 29 to 40 weeks, you'll only do this. No. Along with the second trimester, you will do third trimester also. Like your first trimester exercise also will carry in your second trimester. So your exercise protocol should change daily for them to, be engaged in your exercise program. So if the patient is in the first day of 29, you don't have to initiate full squats. Start wall squats. Do it with the ball. Next. Then you make them, no, you don't have to make them do the normal squats. Make sure they do the sumo squats. Okay. Sumo squats are advisable, not the normal squats. Why? Because in normal squats, you can see the abdomen is getting compressed. They can't go fully down. So sumo squats. Fine. To initiate the squatting, first you can ask them to stand in front of a chair, go down with the help of the chair and get up. Then do it on the wall. Then do it with the ball. Then go for sumo squats. And then duck walking. Yeah, fine. So duck walking, this is how it is done. Ask them to go in the position and then move forward. They can go backward. They can go sideways. So this backward, sideways and all is a progression for them. Okay, this will help in stretching your cervix, stretching all your ligaments and help facilitating the baby to come lower. Fine. So that's about the third trimester exercise. So we had discussed about breech presentation. And I had told you that, they can come to a head down position, by towards the end of pregnancy. We can try, I had told you. Let's see how we can try now. So as I discussed earlier, this is the breech presentation, okay, when the real position of the baby should be head down position. So this is a breech presentation baby. So our breech presentation exercise first is breech tilting or forward leaning, okay. So in this way, first you can ask them to lean in this way and maintain that position for minimum 20 to 25 minutes is minimum. If they can do more than that, well and good. You can encourage them. So you might be asking patients with vertigo and all, what will we do? So definitely during the time of delivery, if they have symptoms of vertigo, they will be going for medications for that because all of the risk of fall is more. So we can go for this breech tilting. And then once they're okay with this, ask them to go a little more forward, like, ask them to sit on the sofa, go down and reach. But with this, they should do it under supervision. You can ask their husband or their mother to be around and then do the exercise, or their partner to be with them and then do the exercise. Along with that, mountain climbers, I had taught you, right? It is an excellent exercise because as I told you, the lower space is getting empty for the baby to rotate. So they will be having space for the baby to rotate. Along with that, I had told you pelvic bridges with ball under the calf, right? So that also gives an excessive space for your baby to come lower. Yeah? Got it? Any doubt? Any doubt in any of the three trimester exercise? Anything that you would like to discuss?
Ma'am, can we give
Yes.
ball rocking exercise, ball hugging exercise
For
the bridge
yes.
tilting?
See, breech presentation, it doesn't mean that you only do these exercises for breech. Along with the other exercise, we will do this also. But the mother is in third trimester. The baby is still in breech means we will avoid those squatting positions and duck walking positions. Third trimester exercises alone would be ignored and rest of the exercises would be continued. Yes.
Thank you, ma'am.
Yeah, no problem. Any other doubts? Any clarifications on your antenatal?
Ma'am, can you suggest exercise for round ligament pain?
Yes, that's what I had spoke to you about. The pubic pain also includes your round ligament pain exercises. It's the same. It's the same set of exercises.
For pelvic pain, can we do the position?
Sorry, for pelvic pain.
Can we do the position where we are in tabletop and the ball is under the calf and the foot?
I didn't get you. Sorry, your voice went off in between.
For the pelvic pain position, can
Hmm.
spine lying with the feet in tabletop position with the ball under the calf and the foot?
Yes, you can do the exercise. There's no issue with it. You can.
Okay, thank you.
Yeah, no problem. Any other doubts? Okay, I think I ignored the chat box. Just a second. Wall and bird is allowed in second trimester or third. You can start with the end of second trimester. As I told you, it's based on your client. If they seem to be fine, you can go ahead with it. Exercises for round ligament pain, the same as your pubic pain. You told us that to exercise, rotate the baby if needed. How is it? Avoid cervical stitch. Cervical stitch? You mean cervical circlage? Okay. Cervical stitch, do you mean by cervical circlage? That is done before the pregnancy. Cervical stitch is done for the patients who have cervical laxity, right? So we can't avoid that. Cervix is, what to say, it is a structure which has to be uh, sutured, right? So there is no strengthening exercises for cervix. You can strengthen the muscles. You can't strengthen the cervix, right? So there is no exercise to avoid that. So cervical circlage patients are actually contraindicated for us. Okay. I hope I cleared all your questions. Is there something which I didn't answer? Just with exercise, baby will come back, or we need some push? No, we don't have to go and push the abdomen or anything. Just exercise and adapting that breech position, the position which I showed you, right? Just adapt this position. Please don't push or anything like that. Okay? This is just an attempt to tilt the baby. And mostly this attempt will work. You don't have to push or anything like that. Butterfly stretch, can we start from second trimester? Yes, that was the second trimester exercise which I told you. I hope I cleared all your questions. Anything else which I've missed means just drop it again. According to me, I cleared your chat box queries. Can we move forward? Do the mother have any breathing problem? Yes, that's why we're training breathing in the first itself. Now, like you can see obesity patients, if they walk for 10 steps, they start panting. So imagine a mother having a big tummy in front of her, it is difficult for her. So we give breathing exercise. And walking is also encouraged. Breathing problem during breech position. Breathing problem is there in breech also, normal delivery also. There's no differentiation factor. Or to adapt the breech position you're asking, yes, they might have some discomfort, but they are supposed to maintain that position. We are supposed to encourage them to maintain that position. See, their first concern won't be their breathlessness. Their first concern is that the baby is not in position. That itself is a stress for them. So they will definitely cooperate with you to do this. Okay. So antenatal assessment. So antenatal assessment, as you're welcome, Rudishri. Antenatal assessment is just like your normal assessment. Okay, there's nothing very specific to add about. So can we have it like a discussion about assessment? Jumping jack. See, jumping jack for normal women itself, if they have obesity, they find it very difficult to do. So jumping jacks comes under little high intensity training for these pregnant mothers. So it is a no. You can do simply up and down that without the jumping, just the movement which we do now initially in the jumping jacks. That you can do, but the jumping one no need to do. So can we discuss about the assessment? Can we have it like a discussion, what all to have and what all not to have? I'll definitely share the assessment with you, but let's have like a discussion so all of you can interact. Yeah. So how will you start with your assessment? Antenatal assessment or any assessment are basic.
Ma'am, subjective and objective assessment, ma'am.
Good. Yes. So first you'll start with your subjective. One second. Is my screen visible? If I write, you'll be able to see, right?
Yes, ma'am.
Okay. So first we're going to deal with subjective assessment. So in subjective, what all comes? Your name, your IP number, or
Personal
OP
data and
number.
history.
Yeah, all your personal history. Of course, continue. Okay. And then they will ask about education, right? So why education is important here? For us to know how much we need to educate them about the antenatal and all that. Okay. Then we can ask their occupational history to see if they're, long sitting there in IT and all, then you can give some ergonomic correction to prevent back pain, long-standing teachers and all, heel pain chances are more, to just have an idea. Next, about the BMI, you can see. So we know during pregnancy, weight gain happens. So how much amount of weight gain is healthy?
11
25.
kgs during the
8 to 10
pregnancy.
kg.
7 kgs, okay. So you can say 6 to 10 kgs is okay. It is a healthy weight gain. Okay. Sorry, 12 to 14. I told it wrong. 12 to 14 kg is a healthy weight gain. Okay. Fine. So next, then we are going to ask about their marital status. To know about their gynec history, marital status is important. Okay. Then degree of consanguinity. What do you mean by degree of consanguinity? So degree of consanguinity means like in some traditional. Yes.
Please continue.
Okay. So in degree of consanguinity, we speak about what to say, like in some cultures or traditions, they marry within the family, right? Yes, marrying a close family relative. Yes, Akshara.
Yeah, in Muslim families.
Sorry, I'm not sure who spoke right now. Could you please repeat? Okay. Then your last menstrual date. Your last menses date can be asked. Then your expected date of delivery. So you know how to plan your program. Yeah. Then your gestational period you can mention. Then is your chief complaints of the patient. So mostly we discussed the chief complaints part earlier itself. Then the history of present pregnancy. Of present pregnancy. So what all will come in your present pregnancy? Is it your first trimester? Which trimester are they? If they are in the third trimester, means get the history about the first and the second trimester also. Like what all they had, what did they do, what was their ultrasound findings, etc. etc. Next, till complaints of pain means pain history. You can use your NPRS scale or your VAS scale. Then they can also ask for obstetric history. So this is not just for antenatal, I'm saying. To an extent, most of your OG assessment is like this. Anything you feel you want to add, you can add. Assessment are all tailor-made. So I'm just saying The important things which you can add. In obstetric history, you can ask the age of the patient at the time of conception. So at the time of conception, I'm just not intending to this pregnancy. If this is their second pregnancy, first pregnancy at what age they had, that also you can ask to know. Like, sometimes, if you go to the general ward, you can see some 20-year-old are all having their third baby in 20-year-old. So just to know their, health status for that reason. Like if you enter the obstetric ward, you can find like people even half your age who are like having their second baby or third baby. So in that case, you'll have an idea, okay, their health might be like this or something like that. Then the GPAL score. So what do you mean by your GPAL score?
Gravity and Faraday score, I guess.
Yes, you're right. So GPAL stands for, it's a pregnancy outcome measure. So G stands for gravida or gravidity. And then it stands for P stands for if it is what type of like the time of paturation. A stands for abortion, and L stands for live baby. So sometimes it is also called as GTPAL also in some places, or in some, what to say, you can say some organizations call it GTPAL, which means gravidity, term, preterm, abortion, and living. So this you can note it down just to have an idea. You can also skip this. It's not that mandatorily you should do all of this. Fine. Next, we are going to speak about the history of previous delivery, if it was there. If any history of previous delivery was there, we are going to ask if it was a full term or what type of delivery it was. Was episiotomy done if it was a normal delivery? So what do you mean by episiotomy?
It's a surgical procedure which is used to
Yes.
widen up the birth canal during the normal deliveries.
Okay. Not exactly the birth canal, to correct you, the perineum. Like we saw, right? Like suppose this is the pelvic floor muscle. I'm horrible in drawing, please excuse me. This is the pelvic floor. You have your urethral and your vaginal opening, and you have your anal opening, right? This will dilate during birth. This is the place through which your baby has to come out. So the stretches so much, there are chances for this to tear. Yeah, the area between this can tear. To prevent excessive tear, they just have a surgical cut of this area. That is known as episiotomy. So if you do an episiotomy, the stretch pain is less and it will help in facilitation of the baby as the mother pushes it. So that is episiotomy. Okay? Clear? So if it was LSCS, suppose if it was LSCS, was it elective or was it an emergency? If it is an emergency, why? What was the emergency? What condition made it an emergency? Next, we have to ask about their menstrual history. So you might think, why menstrual history? Just to know if their hormonal levels were normal before they got, pregnant and all that. And it's a type of, this thing that you have to check in an OG assessment. This is the basic which will be there. Then if they have any past medical or surgical history. So they can have, hernial repair, or maybe, what to say, appendicitis. These are common. Okay, appendicitis is common. In past medical, asthma is common. Then thyroid is common. So all these surgical means your appendicitis is common, hernia is common. So all this, fine. Then you can maybe assess the nutritional status, which is not that important, but if you want, you can. Then you have your vitals. You have to note down the vitals at the time of assessment. And then we'll go for on observation. So on observation, we are going to see if there is any pallor, any clubbing, any cyanosis. About the varicose vein is very important here. Varicose vein is important. Edema is important. Okay. Then some amount of breast examination. If the breast is, enlarged, if the nipple and areola changes are present, not present, if you mention it is enough. Then their posture and gait. Mostly you will see lordotic gait with sway is present. Those type of gaits are mostly seen. Next, we will see on palpation. So since they have a pain history, it's better we check on palpation. So on palpation, what we will see is, just a second. On palpation, what we will mostly see is if there's any tenderness. I'm really sorry. If there's any tenderness. I know my handwriting is horrible, please cope up with it. I'll send you the guidelines, no, just an assessment which you can roughly put up with, but it's purely based on you. Tenderness can be seen. Then on auscultation, we can see the heart sounds, not just of the, you can see heart
Edema.
sounds and breath sounds of the mother. Okay, breath sounds we can see. Then you can assess musculoskeletal, any what to say, deformities are there, any restriction is there, what is the muscle power, like that you can see. Then you can just have your short-term goals, long-term goals, all that you can follow. Okay, this is a rough idea about your antenatal assessment. So with this, we are closing our antenatal session. Any doubts on your antenatal? Till now, so far, any doubts? Anything that you want me to clarify or rectify? With this, we are going to move with the second half of our session, which is the postnatal. So since very clear, ma'am. Thank you, Vijayarani. So if you have a good understanding about your antenatal, postnatal gets even more easier for you to understand. Can you explain later about edema and how to reduce to exercise? So edema mostly where we see is your edematous lower limbs. Why? Because of excessive weight gaining, excessive standing. So all that is possible. Ankle toe movements, elevate your limb and keep. So all that normal. What you give is suggestions you can give.
For frequent
Posture
urine,
care.
ma'am,
Yes, ma'am.
for frequent
Richa, tell me.
urine incontinence, patient has this complaint.
Okay, you're saying if the patient has urinary incontinence complaint. Kegels
Yeah,
exercise.
can we give this?
Yes, yes. Mostly they'll have this urinary incontinence complaint in the third trimester as the baby starts to push down, or in the end of
Yes.
the second trimester. Kegels can be encouraged.
Okay, ma'am. Thank you.
Okay. How will you compare lower limb edema and swollen foot? Diastasis recti exercise. So, can you mention your name, please? So, diastasis recti is something which we see postpartum. Okay, Satyashri. Okay, Satyashri. So diastasis recti is something which we see postpartum. Why? Because our rectus abdominis opens up, they spreads apart, and then they don't come back together sufficiently. Means only we'll see diastasis recti. So definitely we'll see diastasis recti in the postnatal session of us, which we've not started till now. How will you compare lower limb edema and swollen foot? Edema means you have pitting and non-pitting. A normal examination of edema and swollen only will happen for this also. Vijayarani. How to give counseling for labor training, ma'am? In a hospital, they give couple counseling for labor training. You can ask them to do these exercises at home, birth ball exercise. Ask the woman to sit on the ball. Let the husband hold them and go pelvic tilts, pelvic rotation, all the stretches, the pectoral stretch and all. You can ask the husband to stretch it for her, or the partner to stretch it for them. Whatever we're doing assisted, you can ask them to do whatever we do. You just instruct that partner to do it for them. That's it, and give them a clear idea. With the patient having varicose vein, then which exercise is contraindicated? You can follow all these exercises, no issues for varicose vein. Nancy, I think I answered you. Yes, ma'am. Okay. So this is about antenatal. This chat box is open. You can ask me anytime about the antenatal if you have any queries. So can I move on to the postnatal, which is the second half of our session? Since I am hoping that most of you have understood the antenatal to a certain extent, so I am assuming that for you, your postnatal session will be even more easier. Okay. What are the massages we do in the labor? Okay, that's what the postnatal session of ours will talk about what to do during labor and what to do postnatal. Okay. For obesity patients, any avoidable exercise and any add-on. More assistance you can give them. Yeah, you can ask them to go for even more frequent walks. Avoidable exercise as such is not there. Your main this thing is you should not compress the obviously they'll itself not compress your abdomen so much. Like if you were itself sitting, you have little tummy, you go down fully. If your abdomen is compressing you, you will not do it more than that. Na? Same concept. Like for me, I have tummy, so I do not go down fully. It'll hurt for me. So for pregnant ones, they'll be even more careful. They'll still tell you, no, mom, we'll not do this. There's nothing very unavoidable. Can I go to postnatal?
Yes, ma'am.
Sure, ma'am.
Okay. So I've kept the chat box. You can ask me anytime if you're seeing any postnatal exercise, you're feeling any doubts in antenatal, you can ask. I'm not stopping you, but I'm just going on with the postnatal. Okay. So talking about postnatal fitness. So there are basically 3 stages of labor. So some of your articles say there are 4 stages. They're just dividing this second stage into 2. Okay, that is why 4 stages are there, but 3 stages for easy understanding. So first is the cervix will relax, it will dilate, it will thin out. After that, the uterine contract. So when the cervix dilates, I told you operculum, right? Cervix dilates, it will thin out, means operculum will fall down. First sign of labor, you can see it as that. So how to recognize the true labor from false labor? You can ask if they had excessive secretions and all. Okay, that is one sign. Next is stage 2. In stage 2, you will see uterine contractions. Okay, it will increase. Like the uterine contraction in false labor is, varying. It will be okay sometimes, it will be very high sometimes, again will come low, it will be moderate. But in a true labor, we'll see constant increase. Like if this is a graph of pain, it will be a constant increase in their pain. The contractions and pain will be more. In stage 3, Stage 3 is actually in this I told you stage 2 is divided into 2 now. First is the contractions will be seen. That is the first this thing. Second one is that the head will come out and the baby is delivered. So that's how they split it into 4 stages. Yeah. Then stage 3, the placenta is expelled. So after the baby comes out, the umbilical cord and placenta will be simultaneously removed. So these are the stages of labor. So Satyashri has asked, in a week, can we continuously train for stretching, strengthening, or alternative days? Can you give any idea for clinical practice like protocol? Okay. As I told you, for protocol, there is no single protocol. You have to mix. See, one day fully stretching, one day is fully strengthening is not possible in any fields of physio. We give it as a combination. We give mild stretching, we give mild strengthening. We start with stretching for warm up, and then we go for hardcore workouts, and then we go again stretching in the cool down phase. You can follow the same thing, but for them to have a little relaxation between, have 2-3 strengthening for your lower back, like you can do pelvic bridges, then pelvic rotations, then side races, then you can go for clamshell, and then for relaxation you can do cat and camel. But for some people, cat and camel is a struggle. If they don't see it as a relaxation, means you can go for some other alternative which they find it relaxing, just to suit them out. Because for you have to engage them with the exercise plan. I hope I have cleared your doubt. So moving forward with the postnatal, next there's something called as fetal stations. Okay, so fetal stations is like as your baby descends down, what all other halls, not halls, like where all do they cross through? So first they'll get down, they'll be lying above the ischial spine. They'll start coming down the ischial spine. So it's divided into 3 stations, you can say, as a whole. Okay, just for our understanding. Above the ischial spine will be there, with the level of ischial spine will be there, and then below the level. So that's graded from -5 to +5. These stations. Okay. This is just for our understanding. There's no interventions or something which we're going to give for this fetal station. Okay, just for your understanding. What are the massages we do in labor? Okay, just give me some time. I'm reaching there. Okay. So during labor, what all do? We give TENS, massage, relaxation, birthing ball. So in the labor room, most of you who would have gone would have seen it's like a chaotic environment. Like especially if it is a institute attached hospital, you'll find 3 of them looking at the labor, and you'll find the consultant sitting and writing notes. So you would be surprised to see all that. But it's their practice area they've been experienced in. That's why they're doing. So please don't mistake them for that. So TENS we'll mostly keep in the lower back to prevent lower back pain and to reduce pain. But I have seen in some hospitals that they also keep it in the abdominal region. But as for this thing, it's better you keep in the lower back to reduce lower back pain. Abdominal contractions will happen on its own. The midwives are there to help them push and everything. Just for pain, keep it in the lower back. Don't, do something in the abdomen later, it will be an issue for you. Let's not take that risk. Lower back to reduce pain, keep TENS. Massage therapy. You can massage them anywhere and everywhere. There's nothing that don't massage here, don't massage there. Don't massage their abdomen and their pubic area. They're saying back pain. Give them a light back massage. You can do it antenatally also. Tell their husbands or family members to massage for them. Ask their family to have an emotional connect with them through exercise. You can always have these couple sessions and all, or your group sessions in your clinics or in your area of practice. So it also provides an emotional support, and the exercise also gets done. Like you can give them exercise daily, but one day if their partner comes and give exercise, they'll feel like, oh my god, today I've done a great thing, when the exercise would be less done. And it's just that emotional connection is also important, right? Sometimes that support also matters. So seeing to that we will give. So massage mostly lower back for lower back pain. They're having cramps, leg pain, inner thigh. Give a mild needling. No issues. There's no contraindications. Okay. Relaxation technique, normal breathing pattern. So for any client who has come to you from the beginning, they will follow that breathe in and breathe out normally during the time of labor also. So that comes as a habit in their normal breathing pattern, because daily you're telling them breathe in through your nose, breathe out by your mouth, do exercise by breathing in like this. You keep on focusing on the breathing, it will just come as a habit. So as I told you initially, for all exercise, follow the breathing pattern. It's just a matter of 1 week or 2 weeks just to educate them how to breathe. After you tell them the exercise, they will do it by following the breathing pattern by themselves. If not, just correct them. So it's not like a big struggle. Okay. Next, birthing ball exercise. Nothing, just for, you can do this birthing ball tilts, pelvic tilt, up and down, anterior, posterior, sideways, pelvic ball rotations. Just that is enough during labor. Fine. Most of the hospitals do not encourage birthing ball exercise because of cross contamination. Because at that stage they will not be, clothed well, so the infections can cause. So based on your hospital setting, you can go about with it. Or else some places nowadays allow, bring your own birth ball to the labor room. In that case, you can go ahead with it, no issues. It's practically based on the setting where you're working at. So what is followed there, based on that, you can do your interventions. Sorry. Is it clear? Next, let's like how we saw the antenatal changes. Let's see the postpartum changes. So in postpartum changes, you can see soreness and pain in the perineum. So in the perineal region, why? Because it is getting extremely stretched. I drew and show you, right? So you have both the opening, this area is getting stretched as the baby is coming out. So there will be pain. So after that also, sometimes episiotomy will be done, or sometimes it will get teared, like as it is, and stitches might be there. So that area feels swollen and tender. You might have seen in the reels. First, avoiding of urine and feces is very difficult afterwards. Why? Because your perineum is completely torn. So, like, even if you have a UTI, how much pain do you feel? So, if you have this thing, a cut over there, or you had so much pressure over there, it will feel sore. Okay, so for that, what you can say is, we can ask them to keep their knees a little apart. Like, you can keep pillow between your knees and sleep. That can be done. Is operculum and water breaking the same? No, it is not the same. Operculum is just a discharge. Fine. Okay. Next is the vaginal discharge. As I told you, vaginal discharge is lochia. Okay, it's the name for vaginal bleeding. So it will be there even after they did a C-section also. Just because they did C-section doesn't mean that the discharge will not come. It will start with red, and then it will become brown, then it will become light brown, and it will become a whitish this thing. So the entire process can even take up to 6 weeks. So they always will have a pad, or they will have some, tampons or something. So they will use it. Next is uterus involution. So uterus involution is it's basically shrinking back of the uterus. So to inculcate your fetus inside your body, the uterus had expanded. The uterus can't stay in that position; it has to shrink back. So that is known as uterus inculcation, basically shrinking of the uterus. So this entire process can take up to 6 weeks, 7 weeks. It will start immediately after the baby is born. So it's not like it will only start after 1 month. No, it starts immediately. So along with that, after giving birth, also they will find these cramps happening. Like how we feel the period cramps, they'll feel this cramps of a uterus involution. Next, breast changes can be seen. Definitely more amount of milk should be produced. So for the breast changes can happen. Pain can happen. Nipple pain is there because you're continuously breastfeeding. The nipples can be cracked. All that can happen. So hormonal changes. Hormonal changes will cause sweating. Excessive sweating will be there. If at night they'll be sweating, they'll not be able to sleep, they'll be restless. All that is your emotional changes and your what to say, hormonal changes. Next, they can have constipation. Okay, if you had an epidural, it will make your bowels and all go slow. They can have some hemorrhoids postpartum. It is a complication. For C-section, the recovery takes longer because there are stitches. So your rectus abdominal muscle is cut. 6 layers of muscles is cut to have your baby outside. So it will take, I think, approximately 12 to 14 weeks for recovery. Then you can see emotional changes, postpartum depression. It is very common these days. You would be thinking postpartum, the mother should be happy they've given birth, but no, they'll be under depression. So you can, when you're giving your protocol, you can, actually notice that and refer to a psychologist, or sometimes you can itself become a psychologist and just talk to them. Talking to them would make them feel okay. You can inform the relatives, they feel a little low, just be with them. That suggestion you can give. So postnatal assessment. So we saw about antenatal assessment. Now let's see about postnatal assessment. So yes. So talking about the postnatal assessment. Is my screen visible?
Yes, ma'am.
Yes.
Okay. So as we discussed before, name, age, IP, OP, which ward they're in, which unit they're in, you can put all of that. Then you can mention the type of delivery they had. So you can just mention the type of delivery they had, LSCS or normal vaginal delivery, all that. So in your subjective assessment, I don't think this is clear, but okay. In your subjective assessment, you can have your name, all the assessment. Along with that, important things I'll note down here. Date of delivery. What date they had the baby. Type of delivery they had. If it was an LSCS, duration of the LSCS, just to see their, anesthesia, how long it will be there and all that. Then if episiotomy was done, degree of episiotomy, it will be mentioned in the files, okay? Episiotomy, what degree it was done. So at what date and time you are assessing it, date and time of assessment. Like from the date of delivery, when are you assessing it? What is their obstetric history? In short. And their current baby history. Baby weight, baby was normal, the baby was term, the baby's that Apgar score that you can mention. Then if they had any past obstetric history, if that baby was term, was it a girl or a boy, what was their weight, you can mention that. Then if they had any associated problems during delivery, you can see postpartum, it has, reduced associated problems like gestational diabetes, gestational hypertension. postpartum hernia. Okay. That will come in associated problems. No, associated problems, I'm saying like this gestational diabetes, hypertension, like that. Postpartum hernia will not come immediately. It will take time for hernia and all that to come. It will take time. The diastasis recti doesn't, is still there. Then it will take time. Then if they had any asthma, cardiac problems, that you can mention. Then about the Apgar score. So Apgar score is little important. It's like an outcome measure. Anyone who can say about Apgar score? Postpartum hernia, kindly get exercises and what to avoid. Diastasis recti, let me just complete the session, you will get to know. Can you explain type of delivery, LSCS and degree? Okay, degree of episiotomy is like based on the level of which, like the depth of which or the length of which they're making a cut is the degree of episiotomy. LSCS means it's a cesarean section is LSCS, then it's normal vaginal delivery. In LSCS, they'll put a spinal anesthesia and then they'll take you to the OT and then they'll cut your rectus abdominis muscle transversely and then they will do the procedure. Normal vaginal delivery, they'll take you to a labor room. Again, you'll have to push the baby out. That is the difference. So anyone about Apgar score? So Apgar is like an indicator for your baby. Okay. Immediately after birth, you check it in the first minute. Yes, you're right, Aishwarya. It's like they check it at 2 times in 2 intervals, they'll check it. So Apgar, A stands for activity, T stands for pulse, grimace, grimace as in the reflex, if they're, in that or they're floppy or they're, in stimulation, they're having something like that. Then appearance, skin color, they're pale or they're pink, like that appearance. Just you don't have to check, it will be there, you just have to record it. And your respiration rate of the baby. At the time of delivery, they'll check it, I think, in the first minute and in the 5th minute. This is what I've mostly seen. Okay, 2 points they will check and they will say if it is 8 on 10 or 9 on 10, like that, they will mention it there. Okay. Then we have to see the vital signs of the mother at the time of assessment. Okay, so we'll see the vitals. Then on observation, normal build of the mother, if they're having edema, pedal edema, varicose vein, are they having any catheter or any type of, external appliance? If their breast changes are normal, you will see. There's any muscle spasm, you will see. Then you have to assess the diastasis recti. So this is very important. Diastasis recti, suppose the baby was born yesterday. Today you have to go and check the diastasis recti. 2nd day, 3rd day, 4th day, you can check based on your hospital protocol. Just have a talk with your gynecologist before checking the diastasis recti. It depends hospital to hospital, but you can check actually the next day also, you can check according to a few articles, but it depends on your hospital. Okay. Then we are going to go with the management. This is the basic assessment which we need for obstetric after delivery. Okay. Now let's go back. That's an idea about the postnatal assessment. Now let's see. Okay. About the exercise. It's just like your first trimester, 2nd trimester, 3rd trimester, same way. Day 1, you will not go and tell them to do bridges and clamshell and everything. Go easy on them. Teach them breathing exercise, shoulder rotation, shoulder shrugging. Okay. So in the next upcoming slides, you will see I've mentioned phase 1, phase 2, phase 3. If you Google phase 1 exercise, phase 2 exercise, phase, you will not get it. It's just for our understanding that I've made it that way. I've divided the exercise into 3 phases, like how we learned for 3 trimesters. I've divided it into 3 phases. Many of the hospitals also divide it into 3 phases for better understanding. Okay, but if you go and type phase 1 postnatal exercises, you might not find it on Google. Please don't think I've given you wrong content. I'm just giving you an idea. So suppose let's take a scenario. A mother had a delivery yesterday. Today you're seeing the patient. She'll have excessive pain. She'll have discharge. Her baby will be crying on one side. It's your turn to see the patient. So what you would do, you can start with normal breathing exercise. Do little ankle pumps. Do shoulder rotations. Do shoulder shrugging. Then shoulder expansion. Okay. Then you can do some alternative knee bendings and teach them the right feeding position. The right feeding position is in sitting. Okay, erect sitting with baby on their arm. So you can ask them to keep a pillow and then keep the baby on top of it and feed. Don't go for excessive bending and feeding or excessive like increasing the height of the baby and then feeding. Normal sitting position, relaxed way they can feed. Before and after feeding, to prevent all these distance, they can do shoulder rotation, shoulder shrugging, and shoulder bracing. This time, if you ask me, should they follow the breathing pattern? People who have done antenatal will follow it automatically. Or else just try to tell them to relax and do it. So as a relaxation, you can definitely teach deep breathing exercises in first phase. Okay. So phase 1 is actually, I'm telling you, is day 1 itself. Okay. The minimal exercise, what you can do is deep breathing exercise, ankle pumps. Then you can do alternate knee bending, knee bends. Then you can teach them the shoulder exercises, which I told you about. And then you can teach them the feeding position. Okay, this much you can do in the first day. If you are mostly like, definitely after birth, they'll not come to your clinic, they'll be in the hospital. So this is like a hospital protocol I'm telling you, which you can do. Or else, like if you're already in a hospital setup with a protocol, please follow that. You can just advise them for changes. Don't tell them, this is what we have to do. No, it depends on the therapist what to do. I'm just telling you an idea. So next day, the patient pain has come less, you can say. They will not agree the pain has come less, but we'll tell them, no, it's better, you're fine now. We have to convince them to do exercise postpartum. Antenatal also, it's easy to a certain extent. They'll agree to do. Okay, they have to be healthy, they have to be fit. But postnatal, they'll be like, no, I can't. I'm already in so much pain. You're not understanding my pain. You are not married. You will not understand my pain. This is what they will say mostly. So you have to deal with it. So in the second phase, like how we started with the second trimester, like we started with pelvic tilting, we thought, then pelvic rotation, we thought this in first trimester, I agree, but like I'm saying as a progression. Yeah. Then we thought about Kegels exercise, you can teach them. Kegels exercise is very important. Very, very important postpartum Kegels exercise. Urinary incontinence is very common. Please teach them Kegels exercise. Ask them to do it more than 100 times a day. Then only they'll do at least 25 times a day. So Kegels exercise is very, very important. You can ask them to do pelvic bridges. Okay. Then you can ask them to do, like tilting, like they'll not be able to stand and do. So what you can do is ask them to go on supine, twist their hand and keep it in the lower spine, and then ask them to do some tilting on the hand. It is okay. Fine, you can do these exercise along with the knee bending, rotation and all. Just add on these. Fine. Then we are going to go with the next day what we can do. Next day onwards, 100% the chance of discharge is more. So your abdominal core exercises, you should definitely begin. Second day itself, if it is possible, begin. Mostly after delivery, 3 days is what I've seen in here. They'll be admitted. So before the third day, you have to definitely teach them the exercise. So you have to teach them diastasis recti correction or approximation exercise, which I'll tell you later. You can ask them to do how to check the diastasis recti on their own. You can teach them. Along with that, you can teach them SLR with hold. These are the basics for core, right? Then SLR with opposite arm raise, SLR with reg raise. Okay. Then any other suggestion?
But dog exercises.
Sorry?
But dog exercises.
I really can't hear you. What did you say? Change color, it is not visible. Okay, I'm sorry. I think someone had told some exercise which I couldn't hear. Bird dog exercise. Yes, you can. All our normal core exercises you can begin. But minimally teach them this SLR with hold, SLR with neck raise, SLR with the opposite side, pelvic bridges and all. Ask them to continue. Okay. Fine. So that's about your exercise program in your hospital. Maximum 3 days, 4 days, they'll be there, they'll get discharged. After they'll come to you, it's clinic if they have. So when they'll come to clinic, it's with diastasis recti, okay? So if they're really educated people or they had first time a bad experience, they'll definitely, first pregnancy, a bad experience, they'll come to you early. So our normal, our first trimester, second trimester exercises there, no, mostly the second trimester, you can start teaching them. Okay, ask them to repeat the second trimester exercises. This is for your clinic setups and your, home visit setups and all that. Right now, give you a basic hospital protocol, which you can make or, advise your hospital to follow. Now, diastasis recti. I've been saying diastasis recti for a long time. Can anyone say what is diastasis recti? It's the most important part. It's very, very important.
Separation of abdominal muscle.
Separation in
Basically,
recti muscles.
rectus abdominis.
The abdominis has opened up.
Okay, I heard separation of abdominal muscle. Then separation of muscles. Good. What muscles? What abdominal muscle?
Rectus abdominis.
Rectus
transversus.
abdominis.
Okay. So, yeah, I think that. So it is an increased distance between the rectus abdominis muscles in the midline. So the rectus abdominis comes as sheets like this, right? From both the sides, it will start like this. There'll be a line, linea alba, and then it will be like this. This is how it is, right? So this separation is known as diastasis recti. So the linea alba is like the extension of the fascia, and it is also an aponeurosis. So that area is where it usually joins, but it will not join. That is diastasis recti. The symptoms is that there'll be a pooch kind of thing, like a hernia, how we see, same like that you can see. You can see just like already they'll have floppy, the abdomen will be floppy. In center, it will be like jelly-like. Like the abdomen will be floppy, but in the middle, exact jelly like that. There's a trending jelly nowadays, so the cat kind of Japanese jelly. It will exactly feel like that, okay? So that's how it will be in the center. Then there'll be doning of the abdominal muscle. How you can check is, like you can ask them to do neck hold in supine and ask them to do one leg lift. You can see the doming happening just over there, like their abdomen will be flat, just there a dome will come and it will come down. That's one way to check. Then they'll have difficulty lifting objects, they'll have pain when they have an intercourse after that, and then they'll have low back pain, pelvic pain. This is not normal. You can't like distinguish all these. Even intercourse pain, all this is normal. These signs are specific for diastasis recti. So how to assess? Mostly after normal delivery, after 3 days you can assess. For LSCS, they'll have stitches over there. You can't go and assess on top of the stitches. You can only assess after it heals. So after the healing or 6 to 7 days. Yeah, I will demonstrate it, Richa. Okay. So how to assess it? Okay. Is my camera visible? Can you see? Okay. So suppose this is the abdomen. In center you have the linea alba. So most of you who has not had a delivery before, if you touch it itself, you can find like there's an end field kind of thing. Beyond this, it will not go. You cannot feel any separation. Any specific avoiding exercise. Sorry, I didn't. Avoiding exercises. I'll come to it. There's no specific avoiding exercises. Okay. For diastasis recti, there's nothing to avoid as such. So if you touch and see, if you have not had a delivery before, you can feel it. It is very hard. It's not like very floppy. It's normal. Like your finger will bounce back after a certain extent. But for most of you who have had a delivery, you can find some amount of split. Exactly in the linea alba part, just start palpating. Okay. How you will palpate is usually said use your fingertips. So fingertips, you have to press down and see. It will definitely hurt for the mother. That's why I'm saying 3 days after NBD and 6 to 7 days after LSCS. So you'll press it down, and at one point, there are 3 points of assessment. Above the level of umbilicals, at the level of umbilicals, and lower the level of umbilicus. Okay. So you will check and see, and you will see how many fingers are going inside. Like if 3 fingers go like this, 3 width apart. 2 fingers go means 2 width apart. Okay, so this will hurt for them. So use your knuckles. Knuckles means don't give excessive force. Just see if it's going inside. If it goes inside, just see what amount of finger is going inside. Since like if you say 2 finger width means this side 2, this side 2 don't count as 4. It is just 2 finger width. Just because your 6 fingers are going in totally because your right and left 6 are going, it doesn't mean 6. It is 3 finger width. Because each side, right? Each side one muscle is coming. You're checking each side. Am I clear? Any doubts?
Yes, ma'am. Thank you so much.
Yeah, no problem. Any doubt? Assessing diastasis recti?
No, ma'am. Please continue.
No, ma'am.
Okay. So you had asked about diastasis recti. There any exercise to avoid? No. There is no exercise to avoid as such. Okay. Just a second.
Ma'am, mostly people used to say crunches to be avoided. Is it true?
Crunches you have to do for the correction. See, I mentioned here crunches. So I told you the phase 3 exercises, right? All of those is diastasis recti extension. Crunches, side touches, SLR with hold, SLR with like opposite leg touch, abdominal breathing, lying in lying just do heel taps, heel knee pull, anything which engages your core will strengthen your abdominal muscle. All your abdominal strength exercise, please do it. Now they have even delivered the baby. There's nothing to be scared of. Just do it. Nothing will happen. Okay. So that's it. Diastasis recti correction. There is nothing like, you have to follow the correct breathing pattern. Mostly they will itself follow. If not, you can tell them to follow. Yes, any doubts in diastasis recti correction? No. Okay. So
Hello.
I think, yeah, tell me.
Should we manually approximate the rectus and then do the head lift and all that? Or
Manually, how would you? Okay, you're telling me the use of corsets or belts or something like that.
no, means we keep the right hand near the right side of the umbilicus and the left hand near the left, and we
No,
kind of
you should not push the
compress.
tummy together. That will not help. Sorry.
Okay.
You
Okay.
have to strengthen the muscle.
Okay.
You strengthen the muscle, it will get attached back together. It's not, you cannot go and push it. You will get this question. You know, my grandmother has told, can I tie a towel, cotton towel around the abdomen? Will it help? Tell them no.
My
It
question
is.
is that
Yeah.
do we do that compression and then do the exercises, or we
No,
directly
no, just do the exercise. There's no compression.
Okay, thanks.
Okay. But I'm telling you, it's a common query that, you know, this application of this cotton wraps or any belts or corsets, you can tell them there's no need of it. You know, you can't go and push two muscles together. You have to explain it to them that you can't push two muscles together and make them attach. You have to strengthen the muscles from inside. For that, you have to do exercise. But some cases, they will be like, no, this will only help. Means, you know, just give up on it and just tell them, okay, you put it, but do the exercise. But just somehow make them do the exercise. But in Kismet book, it's advised. Kismet, I'm not sure, but you don't see, like, if you have a muscle tear, then why don't you just approximate two muscles together? You don't do it, right? We strengthen the muscle. So it's the same. Kishner. Carolyn Kishner. Or is it some other book? See, clinically till now, I have not done it and I have not seen anyone do it, or there's no article reference for it so far. So I'll get back to you, okay, Colby and Kistner. I'll get back to you with appropriate reference. But as far as I know, and as far as in my thinking, if you have a muscle tear also, we might apply some compression bandage, but we don't go and approximate them physically. So you can maybe tell them to use it cotton things which they want to use for their satisfaction, but ultimately it's the exercise which it works. When should we start exercise? But even next day the patient's ready to do exercise after delivery, you can make them do. But as far as I'm telling you, with their pain subsidence level and their emotional status only, they'll begin with the exercise. So maximum third day. You can't extend more than, at least teach them the exercises by third day postpartum. Then they're supposed to continue it for a long time. They're not supposed to leave it. If they leave it, definitely. Like today, literally today I had a case in the OP. She's a postpartum mother. I'm not mentioning the name. She's a doctor. She's a postpartum mother who had her baby 9 months before. and now she's having hernia. But now she can't do operation because already her abdominal muscles are weak. So the doctor has told you do abdominal strengthening now, and then we will see. So the OP slip, she came with abdominal strengthening, and with her history, she was like, I had a baby. She didn't tell me that she had a baby. She's like, the doctor has told me that, I have to get a hernia operation. So before that, I should strengthen my muscles. So definitely when you do some examination, not always you ask them to lift the clothes off. And seeing her also, I didn't expect her to be a mother. So I was like, okay, did you have any, issues before and all that? And she didn't say anything. Later on, she told me, yeah, after the baby, I'm feeling it floppy. I'm like, okay, now here it goes. And then when you assess the diastasis recti, she had 3 finger with depth. So now I have gone for like diastasis recti correction. So which is like indirectly and directly your abdominal strengthening exercise. So she is supposed to come for the OP 5 days, and then after she's supposed to get a consultation. So this hernia is very common. So sometimes this hernia, if a very mild level with muscle strengthening, you can manage without surgery. So it is like our duty to teach them the exercise and explain them all this. This will happen. That is why we are telling you. If you simply tell them, they will definitely leave it in air. Okay. Any doubts? That's all I have to present. So anyone wants to talk anything, discuss something regarding it, you can definitely. Or anything outside the box also okay. If I have an answer, I'll reply. And Kate Key, I'll definitely come back with more article reference if we can do it or no. But as far as I've seen, I've not seen it in practice, nor I've heard of it. I'll definitely get back with you. Also, I have a request to all of you. Please, in the WhatsApp group, just put a feedback, be it positive or be it negative. Please drop in a feedback. So for my next sessions, I can improve based on it. Is there any more things that you want to know or you expect me to explain? Means let me know. If it's under my knowledge, I'll explain. Or else I'll definitely come back with you with appropriate reference. Just give me 1 day time about the approximation manually. I'll get references and I'll consult with people and I'll get back to you. Any recommendation for postnatal exercise after 2 weeks or 3 weeks, as in when to start cardio and when to go back to gym? Okay, so postnatal exercise you can after 2 weeks. Why do you have to start? You can start immediately. They have to continue the exercise for a long term. And when to start cardio, once their muscles are normal and once their energy level is back, they can start. There is no restriction. They can't start. But they should not start like, initially how they did before the pregnancy. I will do exactly like that and don't go and hit the gym. Do it progressively. You should advise them. More exercise for urinary incontinence. Okay. Which trimester plank exercise start? Plank exercise depends. If it's an athletic patient, maybe you can try in the second trimester, but normal our clients in the hospital side or clinic side, plank is not that much advisable because if they lose balance, they're going to fall on their tummy, which is extremely dangerous. So I personally do not advise plank exercise because there are so many other exercises for abdominal upper limb exercise. Why would I simply take a risk by making them do plank is my query. So if you're confident with it, fine, but I would not suggest you to do more exercise for urinary incontinence. Okay. The webinar is about antenatal postnatal, so it involves pelvic floor exercises. Your urinary incontinence is because of lack of pelvic floor strengthening. Any exercise for pelvic floor, you can go with it. Also, there is a treatment now known as the RPMS, if you're known about it. It's like a stimulation for pelvic floor muscles for your urinary incontinence, etc. So it's like you have to sit in a seat, which gives you peripheral magnetic magnetic stimulation for your pelvic floor. That's a new therapy in field. If your hospital has it, you can go ahead with it. It's an automated program. It comes on the machine. You just have to keep it for 30 minutes. Urinary incontinence is 30 minutes treatment. Or else it's exercise. Kegels exercise. Most important for urinary incontinence, Kegels exercise. Along with the other abdomen strengthening. Is it okay, Maitra?
Yes, ma'am. Thank you, ma'am.
Okay. How to treat diastasis recti after After, okay, it's when it's left like that many years after delivery. Okay. See, many years after delivery, it is like you can just have a conservative type of management and strengthen the abdomen. The extent to which the diastasis recti will come back is less, but strengthening will definitely help them, deal with it. So, abdominal strengthening. In assessment, what is the reason to ask how long spinal anesthesia is there? The dosage of anesthesia and the duration of the surgery, like sometimes, lithotomy position, how long do they maintain? So, lithotomy position is a strain on your back, to be honest. Lithotomy position is used in India for delivery, but actually the most best position to give birth is your sideline position, because in that way your coccyx and sacrum are not flexed. You would say go in lithotomy position, see your coccyx is flexed, and through your coccyx and sacrum the baby has to push through that and come. It is excessive strain. But in sideline, your coccyx and sacrum is in straight position and they can easily push it off and come. Okay, so now you have asked why the duration is exactly this is why. If they had a normal delivery, you have to ask how long the lithotomy position was maintained. Is there any tightness, or to see that. Spinal anesthesia, why is because to see the dosage of anesthesia and how long it would be there. Why they have given that, just for information, nothing like knowing that you're not going to give any treatment protocol. It's just for our information. Suggest some exercises for varicose vein. Varicose vein, the normal exercise which we suggest are normal patients itself. You can give it for antenatal and postnatal mothers. There is no, what to say, do's and don'ts in that for this thing. You can ask them to do pelvic calf raises, toe flexion extension, ankle pumps, VMO type of exercises you can do. Okay. Doing shish. Okay, I'm not very good with yoga, so I don't know how to answer your query. If you send me a picture of the yoga pose, maybe I'll get to know. Or just hold on, I'll Google it and come back to you. You can do Surya Namaskara in this thing, that I'm very sure. Surya Namaskara you can do in pregnancy, it's really good. Oh, that upside down. Okay, the inverted position is safe or no? Yes, the celebrities don't go for it. I am not a yoga instructor, so I don't know how to answer your query. In physio, we don't give any exercise in inverted position for antenatal, postnatal. So I'm sorry, I'll not be able to answer your query. You can definitely ask a yoga instructor regarding it. But yes, if you see technically the space for the baby in the lower abdomen increases only. We give to a mild extent of upside down, that is the forward leaning. But about the exact upside down, I'm not sure.
Okay, ma'am. Thank you.
No issues. Any other doubts? Anything you want to discuss? Any of you want to demonstrate some of the exercises? It will be great. Anything, anyone? Anything you would want to ask? So I have a request from PhysioAssure that if all of you could on a camera, I can just take a picture of all of you in the gallery view. Don't worry, not all of you would be like clearly visible. So please, if you could cooperate. Sir has asked if it is possible. Can all of you cooperate, please? It's a request. And also please make sure that you give me a feedback. Okay, I don't think anyone is opening except you, Disha. Has anyone opened, or I am not able to see? I think no one has. Okay, no problem. Manasa has opened. Thank you. I don't know how to take a picture in this now. 1 second. You can also take a screenshot or anything and share it on your Instagram, so it will be helpful for PhysioAssure to conduct further workshops. Okay, just a second. Let me stop staring my screen so when I can see all of you. Okay. Okay, thank you for opening. So whoever can take a screenshot of it and put it on Instagram is really good. I'll take a picture from my phone. Okay. I hope it's okay for all of you. I'll just send it to him. Session was quite informative. Thank you so much, ma'am. Okay, I hope you had a great time in learning. If there's any doubts in future also while seeing any clients, please don't hesitate. Just give me a message. Yes, immediately maybe I might not be able to respond, but definitely I'll come back to you with the end of the day. I'm not that busy, but I'll definitely come back to you by the end of the day. Okay, any doubts or queries? Anything to clarify? Anything? Anything you want me to discuss? If it is not based on this field also, if I know, I'll definitely reply. Was it informative? Did you learn something new? Or was it everything what you knew before? Okay. So that's the end of the session. Thanks to all of you for joining, and I also thank PhysioAssure for having me. So any queries in the future, you can let me know. Any articles you read, please do share it with me also. And anything, if I get something informative, I'll definitely send it back. And for people and about the manual correction, I'll get back to you within 2-3 days with good correct information. I don't want to misguide you. Anything, you can contact me in the group anytime. Can you share the PPT? Yes, they will be sending you the recorded session also of this class along with the PPTs. PPT and assessment, everything they'll be sending. Thank you.
Thank you, ma'am.
Thank you. Thank you for joining. You can leave or you can, if there's anything, you can stay back. Thank you.
Thank you, ma'am.
Thank you. I'll come back with your answer, Ketki. I'm sorry if I'm spelling you wrong. Any emotional stress exercise, like low intensity. Emotionally, yes, they will be disturbed postpartum. Our only relaxation exercise can help. Like you can give them ball rocking exercise, normal pelvic rotation exercise on the Swiss ball, little bouncing exercise on the Swiss ball. Four square breathing technique or something like that. Just breathing exercise which we can help. Rest you have to give a referral to your psychologist. Like with exercise to a certain extent only we can break down stress, right? So yeah. Anything else? If you have no doubts, you can leave. If you have doubts, you can stay back. I'll close the session in 5 minutes. I'm just waiting to hear from you if there's any doubts. Or anyone wants to talk anything to me also, you can. So shall I end the session or anyone wants to ask anything further? I hope I've answered everything from the chat box.
Yes, ma'am.
Thank you. Bye. Thanks for joining. Just put a feedback in the group for them so they can move it further. Yeah, just all of you put a feedback. If it's negative also, it's okay. I'll improve for the next batch. Yeah. Okay. Thank you for joining. I'm closing the session. If there's any more queries further, please put it in the group or you can message me. Maybe you please don't expect an immediate reply because I'll be working. But whenever I see the message, if I have the correct information, I'll give it to you, or else I'll definitely talk to my colleagues or get the right information and get back to you. Okay. So sir, shall I end the meeting? Are you there? Okay, so I'm ending the meeting. Oh, hope you have
Okay,
a
okay. Thank you, ma'am.
good weekend. Thank you. Thank you.
Okay.